Thank you so much. And I think I have the permission of the Chief Executive to give presents to everyone who came in early before 9:30. So we're giving you all brand new bank accounts to bring in your millions. But thank you for joining us. Good morning once again. We don't take this for granted in any way. Thank you for joining us. Now, more than ever, we cannot deny the fact that the healthcare sector in Nigeria is confronted with several challenges. As a nation, we are currently experiencing a shortage in our health sector, which goes further to emphasize the need for a collaborative approach to solve these challenges. Now, I have good news for you, because Stanbic IBTC Bank has brought the light at the end of the tunnel, because today we'll be having some of the finest leaders and the brightest minds in the healthcare sector discussing a very critical topic, the business of healthcare, challenges, solutions, and opportunities. You'd agree with me that this is so important, especially as we work towards the advancement of the Nigerian healthcare and further move to achieving the #3 United Nations SDG, which is good health and well-being, and emphasizes the need to ensure healthy lives and promote well-being for all across all stages. Now, for us at Stanbic IBTC, this is not just at Stanbic IBTC Bank, beg your pardon, this is not just a talk show or a talk show where we just talk. For us, we have actively walked the talk over the past couple of years, as evident in the bank's collaboration, sponsorship, partnerships, not just in Nigeria, but we've also funded and been a partner to several initiatives, very critical initiatives that have supported the healthcare sector. We also go across the West African region to empower the healthcare sector, because this is very important to us. Now, this event promises to be truly insightful and enlightening, because I did say that we have eminent speakers who will dissect the topic for the day. Now, as we embark on this conversation, we truly hope that we will forge innovative partnerships with one major goal: to catalyze positive transformation within Nigeria's healthcare sector. We have different stakeholders in the healthcare sector in the room today, and we're looking forward to a truly enlightening and progressive day, where we not only hear from our speakers, but we will also hear from all our stakeholders that are here at different points during the course of this event. So thank you for joining us. So everyone who is in the room and everyone who is joining virtually will have an opportunity to partake of this event. So don't feel left out if you're online. But let me just ask that we please celebrate everyone who is joining us virtually. Give them a round of applause for making time to connect with us. So thank you. We also hope, most importantly, that as stakeholders, we will network and form progressive connections that can help further achieve the aim of this gathering this morning. In the words of Barack Obama, the 44th President of the United States of America, he says, and I quote, "As a society, we must prioritize investments in comprehensive healthcare systems that address the root causes of health disparities and provide equitable access to care for all individuals, regardless of their socioeconomic status or background. Only then can we truly fulfill our moral obligation to each other and build a healthier, more resilient future for generations to come." And as we often say, a healthy nation is a wealthy nation. And for sure, Stanbic IBTC Bank certainly understands that. So once again, we'd like to thank you all for joining us this morning as we get on addressing the business of healthcare, talking about the challenges, the solutions, or much more, the opportunities inherent in that sector. As we officially start this event, I would like to make welcome a distinguished gentleman to welcome you all, our esteemed guests, because as the compare, I can only do a light welcome. So it gives me great pleasure to make welcome the #1 man at Stanbic IBTC Holdings. Please join me as I make welcome a visionary leader, a stalwart of the financial industry, and the driving force behind Stanbic IBTC Holdings. Please give a warm, lusty round of applause to Dr. Demola Shogunle as he officially does the welcome this morning. Good morning.
Thank you very much, and thanks for that very long and flowery introduction. Distinguished ladies and gentlemen, please, I'm not a medical doctor, so that we don't cross wires here. My name is Demola Shogunle, and I would just like to start by thanking everybody who has made it here. It's incredible. This is month of February. for reasons best known to, climate, weather, nature, and everything, we are having this, amount of rain, early in the morning, Thursday morning, in the month of February in Lagos. Despite that, we've got, distinguished, participation, from everybody that is here. It shows, our level of commitment, our passion, even for this topic, and for the healthcare industry. So please, thank you very much, for defying the odds and being here very early this morning. I would like to acknowledge, even though he's not here, but he's still part and parcel of the commitment, the Honorable Commissioner for Health for Lagos State. As of yesterday night, he gave his commitment, right? But between yesterday night when we spoke to him and this morning, something else happened, and he had to be there, right? But we still acknowledge, because he's so supportive of what we are trying to do, and it's good for us to actually acknowledge him. So you are all welcome to Stanbic IBTC Bank's inaugural healthcare breakfast session. Your presence here, either physical presence or virtual, is deeply, appreciated. Today we gather to connect, innovators, to connect, disruptors, to connect thought leaders, change makers, who are actually deliberately and intentionally shaping, Nigeria's healthcare landscape. The topic of discourse this morning is the business of healthcare, challenges and opportunities. And I would tell you that topic reflects our own shared, goals of progress through strategic partnerships. We aspire to shed light on how tailored solutions can further support, your ambitious, endeavors. In the spirit of driving Nigeria's growth, Stanbic IBTC has continued to avail credit and support to healthcare entities, thereby supporting hospitals, pharmaceutical firms, HMOs, diagnostic centers nationwide. We are very careful, and this amount we are talking about is into billions of naira. And we are very careful, right, and very, very direct, and we are also very passionate about wellness in the communities that we serve. And we intentionally throw our weight behind the healthcare sector in Nigeria. To all healthcare providers here today, I implore you to explore our specialized offerings that are designed to fuel your aspirations. We are confident that technology and financing structures can actually improve healthcare access, even in the face of macroeconomic challenges. We are committed to supporting your visions. Together, we can advance Nigeria's journey to universal health coverage. We can improve standards of living as well as reduce outbound expenditures that arise from medical tourism as we unpack opportunities for collaboration and strengthen the healthcare value chain for sustainable progress. Ladies and gentlemen, this was prepared for me. I corrected and edited some, but it's not as good as if I talk straight from my heart. So I've satisfied some people, I've delivered the message. This topic that we are, gathered, for which we are gathered today, is so ingrained in the DNA of Stanbic IBTC. Because for us, we look at three sectors when it comes to maybe when you talk about where we want to create positive impact. One of them is health, education, and economic empowerment. So there is one thing to support the healthcare sector with balance sheet, what the bank is meant to do. There is another thing to support this sector with what we are meant to do when it comes to corporate social responsibilities, what we are meant to do when it comes to ESG, medium term, and all those global, development goals is part and parcel of it. And for us in Stanbic IBTC, we believe that we can make that positive impact because we are all witnesses to everything that you can talk about within this healthcare sector. I'll give you one or two anecdotes. I was on a flight, I was coming from South Africa, and two things happened. As we are trying to, we went through immigration, we went through everything. They called a flight, many years ago, pre-COVID. And somebody was coming to Nigeria, a South African, and he was on a stretcher. So the pilot said they should wake him up. Wanted to be sure that the guy was conscious. You are going to Nigeria, this is your international, this is your name. Ask him all the questions. The guy was coming here to Nigeria for miracles, but he was sick. I was in South Africa. I went to see a staff of ours, a branch manager in Maiduguri, who was shot. He had a gunshot wound on his shoulder area. I went to see him because we sent him to South Africa for treatment. So I look at it. Our guys went to South Africa for medical tourism. South Africans were coming to Nigeria for religious tourism or miracle. My wife read economics. She's like, so when I explained it, she said, that's balance of trade. I almost fainted. But why am I saying this? Is that, I attended my first degree, second degree, I attended University of Ibadan. And I can tell you for free, in the 60s and 70s, UCH was a global standard teaching hospital. I attended a program in Harvard with some, family members of the Saudi royal family. And the guy told me that his first time in Nigeria was in the 60s. He accompanied one of his uncles for treatment in UCH. This is from Saudi Arabia. So you can see the passion and the commitment. We need to find a way to get there. And that is why for us in Stanbic IBTC, we believe we can play in the totality of the value chain. I had a discussion last year with Professor Emeritus, I won't mention his name, in pharmacy. And we were discussing. When I started to tell him the value chain within which we are playing when it comes to the healthcare sector, he just had to accept that, look, because it's not noise, it's substance. And by the time I discussed with him at length, both of us we spent 1 hour on the call, going through some documents that had to do with API. API is not within the tech industry. In pharmaceutical industry, it's called the active pharmaceutical ingredients. And that is the backward integration. So we were discussing that, and the guy was looking, and the prof was saying, I said, yeah, because we have to be able to play within the totality of the value chain of the healthcare sector. That is why you will see us, supporting the pharmaceutical firms. You will see us supporting those who are doing backward integration. You will see us supporting, whether you call it, the manpower development, teaching hospitals. I won't mention name again. Another one in Abuja. Almost standing on what now? 10,000 square meters. About 3 floors. We supported them. We had to support them. Because last year, May, I attended a graduation program in New York. A university, in the West Indies, graduated over 1,200 medical doctors and released them into the US for residency. One university. So when I met and I discussed with the vice chancellor of one of the universities here, we compared the number of professors in the 2 universities. He said, look, we need to raise productivity. That university that delivered over 1,200 medical doctors in a year, they don't have 200 professors. So why can't we? And it goes to show, the headroom for growth. So I'm trying to explain to us that for us, the commitment is 100%. We are passionate about this space. And it was as if, because I was having a side discussion, it was as if we've seen some of the barriers in the past. We envision that the banking industry, whether we like it or not, because of regulation, they call them Basel II guidelines. The risk community guys, they know Basel II, Basel III guidelines. There is a limit to what a bank can do. A bank. In terms of giving you long-term, facility. What do we mean? A facility for 10 years, 15 years, 20 years. It's not as if they don't want to do it. If they do it from day one, they will take a provision that will make it suboptimal because of the duration. So what did we do in Stanbic IBTC? About 3-4 years ago, we set up our own infrastructure fund. It is outside of the bank. Before I came to this podium, we were having that discussion. That infrastructure fund is not shackled by the limitations of Basel II, Basel III that a bank will be subjected to. That infrastructure fund is under our Stanbic IBTC asset management. So what did we do with that fund? We went to the Securities and Exchange Commission. We put 100 billion naira program on the shelf. As we speak today, we are almost 75%, in terms of utilization. We have filed another application with SEC. Please, the money is not in our pocket, so please, when we mention money, it's not as if we are carrying them. Because we want to get home safely. Because we've done 75% utilization of that 100 billion, we filed another application with SEC for Infrastructure Fund 2. It's 350 billion. We put it on the program. We put it on the shelf. Anybody here can tap into that. Again, that is where you can get long-term funding. The bank can help with short-term, maximum 2 years, 3 years, working capital. But if you need to transform any of your facilities, structures, infrastructure, that you would need a facility of, let's say, 7 years, 10 years, that is the place we'll point you to. And it shows our commitment. Now, my last point I will make is to let you know, I discussed with one of our customers and we had to interrogate. It's not impossible that they have representatives here, but I won't mention names. The OEMs for most of the equipment that we use in the hospitals. Global OEMs. You understand? So I went to the headquarters of one of them in US. I think it was during COVID or post-COVID. We are the first set of people they will see because we are still wearing masks. The whole building was empty, but they opened the floor for us. And when they told us what they would do, because we have got, an equipment arrangement where, with maybe 20 or 30%, we fund the equipment, we pay directly to the OEMs. You get the scanner, you get the ML, you get all those things. But one of them was giving us conditions that we felt was suboptimal. Those conditions were suboptimal to what they've given Stanbic Kenya, Stanbic in another country. So we had to tackle them. To say that you cannot give us a suboptimal condition because we are Nigerians. And this is the largest market. I can tell you for 6 months, we had to chase them. And we had to get them to back down. To give us conditions in Nigeria that those conditions are comparable to what they've given, Standard Bank, our colleagues, our sister companies in other countries. And that is to let us know that, look, there's one thing to put money down. There's another thing to go and check some of the things that are very, very important to make it easier for all of us. So please take it from us. I hope that you are going to have very robust engagement. As a group, Stanbic IBTC, we put the totality of our weight, behind this sector. Whether it's in the private sector, in the public sector, we are ready, willing. There are some of the, we call them primary healthcare centers, that we've gone ahead to adopt. Right. And, we are doing it deliberately and intentionally to let us see our commitment to this sector. So, welcome once again. I wish, everybody here very successful, robust, and very fulfilling and rewarding engagement. Thank you. God bless you.
Thank you very much, Dr. Demola Shogunle. Please let's give him another round of applause for that passionate delivery, because he did say that he was not going to read his speech, but you can tell with the passion with which he spoke, which was almost palpable, that he genuinely cares about the healthcare sector in Nigeria, because we understand that the healthcare sector is at the center of any nation's prosperity and well-being. Thank you so much, sir, and good morning once again. Thank you all for joining us. I see that the room is fuller. This means a lot to us because this is a very critical conversation that we are getting on. And just as he was speaking, he did say that this means a lot to Stanbic IBTC Bank, especially because the healthcare sector is, one of the sectors they prioritize. And we see by their investments in that sector across West Africa, across Nigeria. So thank you, Stanbic IBTC Bank, and thank you to everyone who has joined us today. I'd like to make a quick announcement that if you'd like to access the agenda, you can check your tables. There's a QR code there. You can scan it. As a progressive bank, we thought not to share sheets, so you can scan. Technology has advanced, and so we are giving you that opportunity to have access to the agenda if you'd like to see the program for the day. I'd like to especially recognize Dr. Pamela Ajayi, who is the President, Healthcare Federation of Nigeria. Please give her a warm round of applause. Thank you for joining us, and let's sustain that applause as she comes to address us for a few minutes this morning. Thank you for joining us this morning. Everyone, please sustain the applause. We're truly honored to have her in our midst this morning.
Good morning, ladies and gentlemen. Our CEO, distinguished keynote speaker Claire, and distinguished panelists, ladies and gentlemen. It gives me great pleasure to be here today at this first healthcare breakfast session sponsored and created by Stanbic IBTC. I don't want to spend too much time because our erudite CEO has actually said it all about what Stanbic IBTC is doing, but I do want to thank them specifically for partnering with us at our recent HFN annual conference and AGM last week. Thank you very much. Making healthcare investable, what an important topic. It is so critical at this time when we are actually in a crisis in healthcare. We are very fortunate with our president who has shone the light on healthcare and has actually prioritized healthcare in his agenda for the country. But we know that it is not just a simple matter of someone shining the light. We have to actually fix the system and fix the system from within. Because if we don't make healthcare more investable, and what is very interesting is many people still think that healthcare should be a social service, not understanding how important it is for sustainability, that healthcare is profitability. I always tell them, I say profitability is not greed. Profitability is sustainability in healthcare. And it is so important that we focus on that. We have a crisis with people leaving the country. If the organizations in healthcare are not being paid adequately, they cannot pay people to actually run the service. And then the people leave. And without people, we have no service. I do strongly agree with the CEO that technology can go a long way towards helping us do what it is we need to do and develop our systems, in particular with extending our services into the rural areas and other places that need care. But all in all, we cannot do all of the above if we do not have infrastructure, if we do not have people, and if we do not have an investable and a vibrant healthcare system. So I just want to say, because I know we have very good speakers coming on to talk, Thank you very much, all of us, for being here, for taking our time out to be here today. And I wish all of us very successful deliberations as we move healthcare forward. Thank you very much.
Thank you very much, Dr. Pamela, for joining us. Give her another round of applause, please. Thank you. Now, distinguished ladies and gentlemen, without further ado, I will be introducing our keynote speaker today. It gives me great pleasure to introduce a remarkable leader and a pioneer in the healthcare industry. She is the CEO of JNC International Limited. With a distinguished career spanning years of dedication to advancing healthcare solutions and improving medical services, she has established herself as a driving force in advancing healthcare solutions and improving access to quality medical care. Today, as we gather to explore new horizons and chart the course for the future of healthcare, we are privileged indeed to have in our midst Mrs. Claire Omasheye grace us with her presence today. Please give her a warm round of applause. She'll be sharing her valuable insights with us today. Let's sustain the applause. We're truly honored to have you here. Thank you.
Thank you very much for that very warm and fluffy introduction to the CEO, Stanbic IBTC, distinguished panelists, distinguished VIPs in the room, our guests online, ladies and gentlemen. Let me first start by saying a very big thank you to the bank for thinking it wise to invest in the healthcare space. If anybody didn't know that healthcare had a direct correlation with economics, I think after COVID, we all can see the direct correlation, and we all have vested interest in the healthcare space to be able to make a difference. So when a bank now decides to be deliberate, to have a breakfast session like this, with all of us here to elucidate the importance of strategic partnerships, and most importantly, about investing in healthcare, we cannot but support you all the way and say a big thank you. So can we give the bank a round of applause, please? So I've been asked to speak for a short while on strategic partnerships, catalysts for transforming Nigeria's healthcare sector. I have a short outline here, which is on the slide, and I'll just move on straight away. Now, when we think about healthcare, there's a lot of challenges, as the president of the Healthcare Federation of Nigeria said. What I'd like to set the tone from the beginning is that although I don't like to spend time on challenges, if we don't know the challenges, then we will not be able to find the solutions. For every time there is a challenge, there are at least 2 or 3 opportunities. So I do hope that at the end of this session, before we go and leave this room, that we will be able to look at healthcare in a different light and see where those opportunities are. Whether you're in the tech space, in the healthcare space, you're in the finance space, there is something in it for everyone to be able to be a stakeholder in this ecosystem building. So having a look at Nigeria and where we are, if I look first at the African continent, Africa has 25% of the disease burden in the world, yet only has 1.3% of the global workforce. The topic at the moment, not only in healthcare but everywhere, is this Japa syndrome, where we're losing our best and brightest to some of the other countries in the world. This is no different in healthcare, and we need to be able to stem that tide. But to be able to do that, we need to work collaboratively, strategically, with government to create an enabling environment to change that narrative. We have poor access to quality healthcare. We have dilapidated infrastructure, moribund infrastructure all over the country. Over 10,000 primary healthcare centers, many of them you can't really attend and go to. We have had brain drain over the years, not a new one, but now, even more than anything else, a very big concern to us. We also have prevalence of communicable diseases, but a double-edged sword with non-communicable diseases. We have a rise in cardiovascular disease. A few weeks ago, we had a football match, and you know what happened when some people watched the match. We had, unfortunately, lost a few people, didn't understand that they had underlying cardiac issues, and some of us are walking and talking time bombs, and we need to do our checkups and go to the hospital more often. Then we have a rise in cancers, and you can probably do a direct correlation with lifestyle, with our sedentary lifestyle, with the kind of food we eat, and things like that. And of course, our life expectancy, unfortunately, in our country is quite low compared to every other country, with 54 years. And I think of a country just close by to us, Ghana, is at 64 years. So there's something that needs to be deliberately done to change this narrative for healthcare. On top of this, we have what we call the patient drain, medical tourism, outbound medical tourism, that is almost more than actually $1 billion on an annual basis that is leaving the shores, that if we can harness this by having the right kind of infrastructure, by keeping our doctors, nurses, pharmacists in country, by having world-class hospitals and having access to finance, both on the demand and the supply side. That means both for the patients to be able to afford it and for the hospitals to be able to provide the infrastructure. We could make a difference. This next slide looks at those 5 pillars when we talk about healthcare strengthening. What are the 5 pillars of healthcare strengthening? So on the right-hand side here, you have healthcare delivery systems. I've actually already given a summary all across board, that the delivery systems themselves are not where they should be. But what I really like to spend a little bit of time on is this issue of healthcare financing, because this is a bank, Stanbic IBTC day. And unfortunately, when we come to out-of-pocket expenses, it is as low as 0, doesn't exist. It is between 62% and in some cases as high as 90%. Now this sounds like, okay, every time I get sick, I have to spend out of my pocket. But the challenge is that we're not talking about out-of-pocket expenses. When we talk about cancers, when we talk about cardiovascular intervention, we're talking about catastrophic out-of-pocket, where people have to make very difficult decisions, where a mother has several children in the house, and she has to choose between which of her kids is she going to give the anti-malarial to. Is it her firstborn, who is a girl? Is it the lastborn, who is a boy? Is it the middle child? What kind of decisions do you need to do? Somebody has cancer and they're in their 60s. Do you spend the money, all the savings, break the bank, sell all the assets? So difficult decisions need to be made, and therefore, when we think about financing, even as a bank, we have to think of both demand and supply side financing. But to the complete left side of the slide, I'd like to focus on the topic of today, which is partnerships for health. We are not doing enough in terms of strategic partnerships and not leveraging on the opportunities. It is great that today we have this opportunity of having healthcare and finance meet head on. And that's what we need. We need the tech industry, entertainment industry, healthcare, to not think in silos, but to come together collaboratively and find solutions that can unlock the potentials. We have a lot of donor agencies that provide funding for various programs, but they're in silos. There's really no collaboration between the various programs. Now we bring it down to 2024 and today's budget. And the next slide shows you about today's budget. We have a very big amount of money, 1.3 trillion naira being spent on healthcare in 2024. It sounds like a lot of money, but compared to the total budget, it is only 4.4%. Now, even when we add all the additional funding that's coming from some of the donor partners, that still only comes to 1.5 trillion naira, which is still 5.46%. Many years ago, we had the Abuja Declaration, where countries in Africa agreed that to be able to give people access to universal health coverage, we need to have at least 15% of the total budget of a country spent on healthcare. So it shows we have a long way to go. However, I'm not a politician, but you must give and tap the back of government when they do the right thing. Next slide, please. This year, in 2024, we are blessed to have, under the leadership of the president, a focus on healthcare. When politicians start to walk the talk, we have to say thank you. Why? Because if you do not have political will, then we can't change the narrative. Access to finance for the masses can only come from government resources. It really can't come from private sector. But in this budget this year, we're seeing a huge focus on infrastructural development in the public sector. We have over 77 billion naira, which is going into revamping various hospitals in the 6 geopolitical zones, their diagnostic capabilities, MRI, CTs, and so on and so forth, laboratories, theaters. This is a great start in the right direction. And under the leadership of Dr. Pate, Professor Pate, Dr. Lausa, and the PS, we have a trio who are really determined to walk the talk. It is us in this room now that need to put a scorecard with them that makes sure that that goes from walk to talk. And I'm sure that we can do this together. So what is the importance of strategic partnerships, and why do we need this to happen? I totally think that collaboration is the new innovation. And without collaboration, we will not be able to change the narrative. And it's important for transformation. We have on the slide here the things that just show you how this is important. If 75% of the medicines that we use in Nigeria are imported, if we had another 6 months of COVID, we would have had complete drug insecurity. There would have been no access to medicines because our pharmaceutical industry was not in a position to be able to provide it. We had no real API, active pharmaceutical ingredient production. So there's a lot that needs to be done across the entire value chain. So though we are focusing a lot on hospitals, we need to do backward integration into all the various consumables, pharmaceuticals that are required. We need to have resilience with drug security, medicine security, and that means homegrown solutions. We need to have policy that encourages, just like what the industry did, oil industry, where they had and ring-fence local oil companies. We need to have the same in the healthcare sector, where local producers are given preference, even if it is 20, 30% higher, then we need to buy Nigerian for Nigeria, buy Nigeria first. That is the kind of policy that we need to be able to have. So strategic partnerships are very essential for various reasons. And to be able to get this going, we must first be able to influence policy. So I'm really happy that Dr. Pamela Ajayi is here, because the truth is that everybody trying to talk to government alone is not as impactful of all of us coming together to unite with one voice. So in the healthcare industry, we have the Healthcare Federation of Nigeria, which directly interacts with government to influence policies. And I must say, over the last 10 years, there's been a lot of impact that the Healthcare Federation has done. So thank you very much, Madam President, for the wonderful work that you're doing. Of course, we also need to leverage on speed and efficiencies. When people come together, great ideas, each of us levers on the strength, we're able to make things happen better. We need to risk pool. There is a lot of risk when you do business in our climb. But when we are working collaboratively, we are slightly and helping to de-risk transactions. Banks like this kind of words, de-risking transactions, making it less risky and so on and so forth. We also unlock creativity and innovation, which is very essential to be able to change the narrative. We have to collectively solve problems. So one idea cannot be the same as three people, three companies, three different market segments coming together to solve problems together. And of course, we need to be able to be resilient and adapt to change. So these are some of the things that we want. And finally, with those partnerships, we can then scale up, and we need to be able to scale up. Disruption that we're talking about is innovative disruption, not just disrupting ourselves and not just doing things out of the box for no reason. We have to almost throw away the box and don't be limited by the box. We have to think differently, disruptively, and innovatively. So from all our standpoints, anybody in healthcare, yes, we have to start with optimizing your operations, but we need to leverage on technology and learn from other industries. If I look at the banking sector, when I was in university, I had to go to the bank, drop my check, they give me a tally, I wait 5 hours, go back and see if my money is ready. Still no guarantee. Now I can dare anybody, fastest fingers, can you transfer even ₦1 million in 30 seconds? And most of us here can. That is the role that technology has changed in transforming the sector. How do we take those learnings from entertainment, from real estate, Airbnb, hailing a taxi, to banking, to healthcare? How can we bring it down and provide, using technology, access to quality healthcare, to the rural, to the last mile? These are things that we need to do differently. And the answer really is going digital. So for us to be able to think strategically and to think about strategic partnerships, what are the things and what are the benefits that we can do to be able to make a difference? First thing I think is domestic resource mobilization, that we can together think of different ways, finance, healthcare, tech, coming together to mobilize resources. Also look at ways in which we can either do, I don't want to call them sin taxes, but look at innovative ways of finding maybe luxury taxes and channeling it to providing finance on the demand side, whereas the banks can look at the supply side. But we have to fix two sides of the equation, because there's no need of collaborating, having big hospitals and pharmaceutical industries everywhere, and the average Nigerian cannot afford the treatment or afford the drugs. I was told a short while ago that a lot of people who are asthmatic on a particular drug before, it was less than 10,000 naira. And now for this same drug, it's in excess of 60 to 70,000 naira. Now we need to have our homegrown solutions, our own R&D, do some backward integration. We have, and our forefathers had a lot of medicines that could help with things like that. But in the meantime, prior to us doing the R&D, we need to have the security in our country. And therefore, there needs to be collaboration. Perhaps government needs to collaborate with private sector to build specific industries that tackle our major non-communicable disease challenges. And working alongside banks, working alongside institutions like Stanbic IBTC, we would be able to collectively change that narrative and do the resource mobilization. Public-private partnerships have not been new to Nigeria, but we need to go from the small PPPs that we have in healthcare to the PPIs as we see in the UK, in Turkey. I have done many trips to Turkey and I've seen the amount of infrastructure they have there. The entire system in Turkey was built on public-private partnerships. But the difference is that the government becomes an off-taker. And when you have an off-taker, it spurs investment because you're sure you have been giving guarantees. If I'm given a guarantee that I'm going to have 1,000 patients come through my door every month, I will make the investment. And I'm looking at investors in this room. The banks will also lend money because you have an off-taker. But in the absence of solving both demand and supply side things, it is very difficult. In PPPs too, we also need to have the right enabling environment and framework to protect the investors and the bankers. And when you have, for example, in certain hospitals, bad practices where people leave the hospital and they go outside the gate and provide services to people outside the gate to earn a commission, we need to get rid of bad practices that are de-incentivizing healthcare investments. There are lots of new policies that have been worked on. We need to make them workable. We have an incentivizing healthcare investment policy. We have a dedicated public-private partnership policy, but it has not been implemented. So working collaboratively with the bank, with your bank, for example, would be one of those ways in which we can change that narrative because we need the right regulatory environment and legislation to be able to protect our investments. We need to be deliberate about capacity building, and strategic partnerships gives us an opportunity. What is the use of having all these high-tech equipment, linear accelerators, MRIs, and CTs, and you do not have engineers, homegrown engineers in country to fix them? They were waiting for expats at the dollar rate of, I'm not sure what it is today, but I can dare say almost 1,900 because the last couple of days it's been going up exponentially by 50 to 100 naira. But can we afford expats to be coming in and be paying dollars? It's bad enough that we have to import the equipment, and on top of that, we now layer the service. So we need to have a curriculum in our medical schools, in our biomedical engineering schools that is relevant, and then part of our responsibilities of collaboration needs to be capacity building and advocacy for that change. We have partners internationally that we need to work with private sector. Most of the time, these partners, please put the partners up, they work only with government. But I'm sure, and I'm seeing a lot more now, that some of these partners are now interested in working directly, providing capacity building grants with the private sector. So the Bill and Melinda Gates Foundation, JAPIGO, USAID, Global Fund, PEPFAR, UKTI, lots of them are already in the country now working and utilizing private sector. The value chain, the supply chain of the private sector. We need to leverage on this and lobby and advocate. This is where the banks can do some mezzanine financing, where you do blended financing. Take your commercial financing, add the patient capital, and give us patient financing for our patients. Yes, that's what we require. So with public-private partnerships, as I said, we need to get through this hoop, work collaboratively with federations like the Healthcare Federation, with PSHAN, with the NESG, and be able to advocate for a change in policy to create that enabling environment for public-private partnership. So to try and conclude on this, how do we take this forward from just talking about collaboration from talking talking about the importance of working together to being very strategic and changing that narrative. First, I'd like to just emphasize this importance of going back to the basics, understanding our challenges. For every time there's a challenge, looking at where the opportunities are, streamlining the opportunities, because we cannot be everything to everyone. Let's find the things that are low-hanging fruits that have the biggest impact together. Let's again advocate for the enabling environment that gets rid of multiple taxation, that gets rid of the bottlenecks at the ports, that stops customs from changing tariffs every other day and making it almost impossible for you to price, to stop the bottlenecks of bureaucracy with some of our regulatory agencies that make consumables and things coming into the country very difficult and very hard for our hospitals to be able to provide a service that is great. We also need to enforce the mandatory healthcare insurance, and government needs to put a dedicated budget that pays for people together. Now, this collaboration, this ecosystem building is a collective responsibility. So to conclude here, if we don't collaborate, we stand where we're at a point where the silence in the room says it all. We don't have a choice. We either collaborate, we either disrupt ourselves, or be disrupted. The choice is ours. So today, I'm sure that the speakers on the panel are going to do a lot of justice to show us that collaboration and strategic partnership is the only way out. It is something that's going to make a difference in healthcare and make healthcare a major contributor to GDP, just as it is in every other clime. In the US, healthcare contributes between 9 and 11% of the GDP in the country. So we need to be able to do that same thing. So we do have an arduous task ahead of us, but with our concerted efforts to make a difference, we will be able to do the right thing. Put the governance structures in place, get the right regulation, get an incentive, a basket of incentives, both physical and non-physical incentives in place, redesign the system for success, and finally, do innovative financing. Think out of the box. And I dare say that Albert Einstein said, in the middle of every difficulty lies the opportunity. In all the difficulties that we're going through, with all the challenges that we're going through, ladies and gentlemen, there are vast opportunities to invest in the healthcare space. I dare say that let's all know that this is a collective responsibility, and victory comes from when you find opportunities to problems. So please, find opportunities to problems, and let's take our country forward. Thank you very much.
Thank you very much, Mrs. Claire Omashe. Our keynote speaker has done justice to the conversation around strategic partnerships, being a catalyst for transforming Nigeria's healthcare sector. Thank you. And I think one critical thing that stood out for me is the fact that collaboration is the new innovation, and I think that is so phenomenal and profound. So yes, we're talking about collaboration on a larger scale, but let's start from this room. Do you know the person sitting next to you? I mean, we have different stakeholders, so let's connect, let's collaborate informally before we look at that bigger picture. So we do have various stakeholders, so ask them for their names, what they do, what sector, what part of the value chain they operate in, and how you can connect with them. So this is a good time to exchange your cards, a good time to actually start that collaboration that we really, truly want. So please get their names, get what part of the value chain they operate in, and how you can be beneficial to their business. So make sure you're connecting with at least one or two persons. So you have someone to your left, someone to your right. Ask them questions. You can start by complimenting them, maybe, and then ask them for what they do, their business. You never know. Your next business partner or your next investor may just be sitting next to you. So this is a great time to connect and ask the right questions. Awesome. I love the energy in the room. I totally love it. Great. Interesting. I love this energy. That's great. So make sure you take someone's cards or two people's cards, exchange your complimentary cards, take their numbers, ask for their office addresses, visit them, find out what they do, and you never know. You never know. You just remember today for good. Thank you. We have a tea break after the panel conversation, and of course, we'll get to engage in further networking. So let's come back into the room. Let's come back into the room. It almost feels like we're waiting for this moment. I'm enjoying this energy in the room. But thank you. We need to take the panel conversation now. And then we will go on a quick tea break where we can further network, exchange contacts, just start the collaboration from this room. Thank you. All right, thank you very much. And I think I have a very important announcement at this point, ladies and gentlemen. Okay. This energy is great, so I would allow the network and exchange of contacts. I'm loving it. I'm loving this energy. Fantastic. And if you are online joining us, please make sure you introduce yourself. Tell us what you do. You never know who's watching and who may pick up your contact and who's been looking for a business partner like you. So if you're a virtual participant or a virtual stakeholder, please use the chat room feature of whatever platform you're joining from. If you're using the events app, if you're using joining from Facebook or YouTube, just drop your name, drop what you do, drop what service you provide in this value chain, and let someone who is also joining virtually find you. So you're not left out of the networking happening in the room. So there's virtual networking happening on the app, on Facebook, and on YouTube. And there's also the networking happening right here in the room. There's exchange of contacts happening here. So to all our virtual participants, make sure you're networking and connecting on. Very good, very good. Very well done, everyone. So after the panel conversation, we will have a quick tea break before we return to the room. And of course, we'll have more time to network and exchange contacts amongst ourselves. All right, thank you, distinguished ladies and gentlemen. Welcome back from that quick networking break. Okay. I totally love this energy. I'm really loving it. We will take a panel conversation now. That is because I'm assuming that we are back from the networking break. But right after the panel conversation, we'll give room for about 2 questions and we'll proceed on a tea break before we return to the room. During the tea break, we can further network and collaborate and ask questions, network, take pictures, connect with people in the room. We have various stakeholders from across various parts of the value chain in the healthcare sector. So this is a great time to network, but that would happen during the tea break. We'll give a few more seconds so we can settle in this stellar panel that will do justice to the conversation that focuses on the business of healthcare, talking about the challenges and, of course, opportunities, because it's one thing to iterate the challenges, but what is most important is to talk about the opportunities that are inherent in these challenges, especially as we've heard from our keynote speaker, talking about victory coming from identifying the opportunities that lie within challenges. So we'll look at that in a few seconds once we settle in very quickly. I would like to thank everyone for joining us. I was a little worried when the rain started. I thought the room would be half empty, but this is very impressive. We thank you all for making it here, whether you swam here, whether you drove here, however way you got here against all odds. to get on this critical conversation. We don't take it for granted in any way. Thank you for supporting this cause that we passionately drive at Stanbic IBTC Bank. Okay, distinguished ladies and gentlemen, welcome back. Thank you. Thank you very much. Welcome back. Thank you for indulging me. And I feel like that was a very great part of today's breakfast session. We needed to collaborate, network, even from the room before we go on the bigger scale. And now a final announcement before I introduce our moderator. When all these partnerships have been formed, when you're about to launch your businesses, my name is Mojibade Shusonya, and I'm a professional compere. I host official launch of businesses as well. So please feel free to reach out to me after these partnerships have blossomed into something great. I would now like to invite on stage to do justice to the conversation that we are having next. Our conversation focuses on the business of healthcare, the challenges, and of course the opportunities. And I mentioned earlier that our keynote speaker spoke about how victory comes from identifying the opportunities that lie within challenges. So we'll be looking at the business of healthcare that we've been talking about, so the focal point of this conversation is on the business of healthcare. We'll talk about challenges and of course the opportunities. I'd like to make welcome our able moderator who will steer this conversation further. Please join me as I make welcome the head of specialized sectors at Stanbic IBTC Bank, Jane Ike Okoli. A round of applause for her. She'll come up stage to receive other members of this stellar panel who will do justice to the conversation. Now I'd like to make welcome the Chief Executive Officer of Iwoso Investment Limited, who is also the co-founder of Iwoso Investments Limited, a health investments holding company and owners of Iwoso Lagoon Hospitals. She was previously director at Investment Fund for Health in Africa, a pioneer private equity fund focused on healthcare in Africa. She holds an MBA from Harvard Business School, class of 1999. I wasn't even born then, but that's okay. Please let's make welcome Mrs. Fola Lawi. Thank you very much for joining us. I'd like to also make welcome the Chief Executive Officer of Sygen Pharmaceuticals Limited. He's also the Managing Director at Sygen Pharmaceuticals Limited, bringing experience from previous roles at Coronation, Etisalat Nigeria, Diageo, and Diageo Nigeria PLC and Guinness Nigeria PLC. He holds a master's degree in management engineering at University of Pennsylvania with a robust skill set that includes strategy, business strategy, change management, strategic planning, business transformation, and more. Mr. Charles Ogunwi contributes valuable insights to this industry. Please give him a warm round of applause. I see that he didn't let me read his bio before he came up stage, but we're truly delighted to have you here. Next, I'd like to invite the founder and managing director, Tilit MSME Microservices Nigeria. Tilit MSME Microservices provides advisory and management services to public and private healthcare organizations across East and West Africa to maximize the value and outcomes of their social impact and commercial investments in healthcare and social services. He's a social entrepreneur, healthcare thought leader, and management specialist with a background in medicine. Please give a warm round of applause to Dr. Abayomi Sule. Thank you very much for joining us. Next, I'd like to invite on stage the COO of Codex Pharma Limited. She graduated from the University of Lagos in 2004 with a BSc honors in pharmacy. She worked at the Lagos State General Hospital as a pharmacist and later joined Innovative Medical Services Hospital, Lekki. She completed her MBA at the Lagos Business School in 2011, after which she began her business development career with Codex Pharma Limited. A round of applause for pharmacist Mrs. Mary Ogangu. Thank you for joining us. One more time, I'd like to invite upstage our eminent, distinguished panel, our keynote speaker to join this panel conversation. A round of applause for Mrs. Claire Omasheye, who is the CEO of JNC International Limited. And finally, but certainly not the least, I'd like to invite the Chief Executive Officer of Bastion Health. She's previously worked at Access Bank as a senior manager and at AXA Mansard as a deputy general manager. Please make welcome with a warm round of applause, Ms. Naomi Aduku, to join this stellar conversation who will do justice to the business of healthcare. At this point, I will hand over to our able, capable moderator to steer the conversation from here. Over to you, ma'am.
very much, Moji. Ladies and gentlemen, especially, ladies and gentlemen in the room, especially to our audience online. Once again, my name is Jane Ike Okoli, and I head specialized sectors. I'm very pleased to be the moderator of this distinguished panelists. I am excited because we look at the team that we have actually carefully curated. They represent every player in the healthcare value chain. And speaking of the value chain, from the purchasers to the producers to the providers that you and I patronize every now and then, to the fiscal intermediaries, I want to call them intermediaries, and then last but not the least, the payers, you and I. Every part of the value chain is actually represented here. And I am even more excited that we would be getting thought-provoking insights and recommendations that would certainly add value, which is what Stanbic IBTC is known for, to our audience, as well as, audience in the room and our audience online. So without further ado, I'm just going to get right into it. I'd like to start with Mrs. Lowry. I think it's a known fact that medical tourism is a big challenge. We lose billions in medical tourism year on year. What are some of the reforms that the government has put in place that can sort of catalyze investment in the sector, specifically investment in centralized accreditation, digitization, and of course care guidelines that would further unify our fragmented healthcare quality standards? Yes.
Oh, great. Good morning. Good morning, ladies and gentlemen, and good morning, Jane. Of course, I don't think I have to sort of say too much about the fact that it gives me great pleasure to be here. Certainly, Stanbic has been sort of blazing the trail over the last couple of years with these discussions, and particularly also in putting their money where their mouth is, which is really great to see for the healthcare space. I think, yes, indeed, the context itself is important, the context of why, medical tourism in the first place. And I think, we know that has been happening really because there's been two issues. One is the infrastructure, that is on ground, to date, still has not really been able to catch up with the disease prevalence that Claire mentioned. The last sort of 10, 15 years, we've seen the growth of the very major diseases, the cancers and the heart disease, diabetes and so on, which, to be honest, we just are now playing catch up in terms of really having the infrastructure and expertise to be able to look after. And therefore, people have to seek, care elsewhere outside of our shores. But in addition to that has been trust, and that even as we have started to build that ecosystem locally, people are still finding it difficult to trust that what is on ground really can cope. I think COVID in itself created a little bit of, maybe I'll even call it, dare say, an opportunity, because with the shutdown and people couldn't travel, our community couldn't travel, we had to look inwards and find solutions and find care where we could. And it made, at least there was more of that interaction with what's on ground. Now, some of it was positive and, but a lot of it was still, a lot of room for improvement. And that really has brought back, I think, the issue you've raised of, how do we really make sure that there are standards, there are guidelines, what needs to be in place to really help us to, overcome the trust issue. Certainly, government is trying. If I look at state governments, particularly Lagos State has, and all states actually have their own, what you call healthcare monitoring and accreditation boards. In Lagos, it's called HEFAMA, which has taken a much stronger approach, to be honest, in ensuring that there is a minimum standard of even infrastructure, first and foremost. So are you sure that there is constant power Because those are the types of things that are still an issue. You know, you go into surgery and you don't have backup power. I mean, of course, a lot of things can happen, and that's the kind of issue that, you know, the customer at the end of the day, you know, is sort of trying to guard against. So do you make sure that you have all the, you know, the minimum in terms of infrastructure? And then, of course, on top of that, you have also agencies like the National, the Medical and Dental Council of Nigeria, MDCN, who again regulate what I'll call the healthcare talent, you know, the doctors themselves, and ensure that they are professionally capable and that they are doing the right thing. So there is a lot of focus on that area now from government's point of view to say, how do we make sure that there is a better regulatory framework around even investments that are coming in. For us as a private sector and private investors, we like to see that there is a level of internal regulation at the table. So everything from internal audit, internal control, clinical governance, and all the way out to what you call voluntary accreditation, to see whether that is already in place, even as we're thinking about investment, because it's really critical.
Absolutely. I mean, well said. I'll just go, Mrs. Cleomasha, we can't have enough of you. You know, the purchasers and the producers, which is where you would have the dealers and the OEMs, play a very critical role in the healthcare value chain. But we've seen that one of the biggest challenges that they have is actually that heavy dependence on importation. I mean, for all obvious reasons. What exactly, do you think that players in this industry or in the value chain should be doing to align with you know what is going on right now?
Okay. Thank you very much, Jane, for that question. I think anybody that is a representative of an original equipment manufacturer, what we call an OEM, has a responsibility first of keeping to the principles of the OEM. But when you come into our jurisdiction, Nigeria, we need to have a very long-term approach to things. So you can't come into the Nigerian market thinking short-term. You have to have a long-term approach. You have to have a collaborative partnership approach to the market. You would need to definitely start with some kind of needs assessment. Look at where the things, you know, what kind of equipment do you require? A lot of people come in with preconceived notions, 220 million people, and they start to do the extrapolations for you and say, that means you should be able to sell 100 CTs a year. You should do 1,000 cardiac operations every month. I mean, they give you all kinds of, you know, numbers that have absolutely no bearing with reality. So you need to do a needs assessment, not by just getting a consultant to do it, but actually rolling up your sleeves and speaking to people. Go to the various hospitals, speak to the medical directors. Go beyond the medical director, go to the director of procurement, go to the head of nursing. 70–80% of the time in a hospital is spent with nurses, not doctors. So go to the nurses, find out what the real needs are, and then you can really find a solution. So you have to come in with a solutions approach to things. As I said, long term. One of the challenges we had, as I highlighted in my earlier talk, was the fact that we do not have today's level of biomedical engineers. So you need to make an investment in capacity building, starting with yourselves and then going to the market itself and helping the market. With the JAPA syndrome, a lot of our clients, for example, that we had trained on machines 2 years ago, many of their staff are no longer there. And therefore, you have to have a concerted effort to work as a partner with the industry. If you come in as a salesperson and take everything as a transaction, it's not going to work. So you must have a long-term approach, and you must also find a solution. So what are the pain points of our clients? And I would tell you the first one would be access to finance. So what do our clients require, and how do we help to make that access to finance or funding very more affordable, more available, more long-term? How do we disrupt the normal way of providing the statutory standard collateral and think about maybe new models like leasing? Or even if it's leasing, at what cost? How can we do some kind of mezzanine financing and bring in things? But so you have a responsibility to of engaging banks, of engaging the government, either through the Healthcare Federation or yourselves, and creating this enabling environment for us to thrive. So there's quite a lot that needs to be done. At some stage, you will need to also understand that government is not going to continue to buy from you for 5, 10 years without some form of backward integration. So I think everybody, and I can see a lot of my colleagues in the OEM space or rep space, is that all of us at some point need to start thinking of backward integration into some kind of production in Nigeria. So just a push that is going on in the pharmaceutical industry, we as OEM reps, we need to push our OEMs to start some production, even if it's only CKD, and completely knock down an assembly, and then get the government to provide some kind of guarantees if that is possible. Then finally, think about public-private partnerships and private-private partnerships. You cannot, I tell people all the time that, you see, when you have lawyers, the lawyers don't have customers, they have clients. We have to see everybody that we interact with as a client. You must build trust with them, and that's the way to go. And for us as JNC International, it has been from day one. We didn't see ourselves as sellers, we see ourselves as solution providers. We see ourselves as an ecosystem builder and providing solutions to the market. It's our responsibility not only to increase diagnostic capability, but to also work with our various partners to have interventions in country. Medical tourism is, for us, a sign of failure on our part. So if we continue to export our patients and our patients don't have trust in our system, we have also failed. So the collective success is our success. The failure is also a collective failure. So we have a responsibility to represent the right kind of companies that think about Nigeria in the long term and are ready to invest in the space. And if they're not, please get rid of them. Thank you.
Thank you very much. I couldn't agree with you more. Another player in the value chain that is heavily dependent on importation and specifically on the APIs, the active pharma ingredients, is the pharmaceutical, the pharma manufacturing players. And Mr. Gunwi, I'm coming right to you. What exactly do you think pharma players should be doing? It's not just, depending on what is coming in, but in terms of how do they key into the measures that the federal government has already taken to encourage local production?
Well, thank you, Jane. The measures, I think, are largely driven by the regulators. So the regulatory body, NAFDAC, is really encouraging local production. And that backward integration from an API standpoint is something that they're really pushing hard on. I think if I look at what a lot of pharmaceutical companies are doing, is they've raised their games internally. So a lot of them are striving for WHO certification. NAFDAC itself has raised the game. So there's a lot of capability, local capability now, right? And those standards have really gone up. I think the challenging part for the local manufacturers in pharma is the right kind of financing. Claire mentioned patient financing, right? In our environment, if you do not get the right kind of financing that allows you to produce affordable drugs, right? The end patient, yeah, we don't use customer for the patients, right? They would not be able to afford it, so it would totally be unaffordable. So I think what we need to do is go back to looking for creative ways to enable the manufacturers to be able to produce affordable drugs. But I think in terms of capacity, capability, and preparation, the industry is prepared. Right. Yeah.
Thank you very much. I mean, statistically, the pharma market is only serving less than 40% of the country's pharmaceutical needs. I mean, that's to tell you the kind of opportunities we have, largely untapped. And this is where we also need to focus, a bit more. In the pharma manufacturing, aspect of the healthcare value chain, you also have the preventive. So you've got the curative part of it, and of course your preventive aspect of the business. And I'm heading to Mrs. Mary. Codex has done a lot in terms of the production of test strips, devices, medical devices that would help in disease management. Today, one of the biggest challenges globally is the global disease burden. Africa is getting about 25% share of that. Of course, Nigeria is a significant part of the continent. So I just want to find out what exactly, how are we positioning ourselves, to manage this going forward, to sort of partner with international organizations so that when another COVID hits, I'm not saying if, it will come, but it depends on how prepared we are. How do we manage that then?
All right, thank you very much, Jane, and thank you to the Stanbic IBTC team for giving Codex the opportunity to share our thoughts on this very important topic. And I also have to recognize my auntie here, Mrs. Kaomashe. It's such a privilege to be on this panel with you. Okay, so to go to your question, I would start by saying we have started preparing for the next pandemic, but we haven't done enough. So before coming here, I had like a myriad of challenges, but I would like to focus on maybe just about 3 of them. Now, during COVID, and we all know how COVID went, one of the things that stood out was how it is necessary for every nation, every sovereign nation, to secure their borders, whether it be from economic challenges or health challenges. And so Codex Pharma Limited was right in the middle of that conversation during COVID-19. And before COVID, I would say around 2018, we already saw the need to, should I say, backward integrate and secure the future of the organization, but more so secure the health of our patients, and I will explain why. So today you will hear a lot of conversations around localization. The likes of PEPFAR, which Mrs. Omashe clearly hinted at during her presentation, has been one of the very loud voices in the area of localization of RDTs in Africa, in LMICs generally, but mostly in Africa. And I will throw out some information which we may already have. But PEPFAR has it on good account that out of $750 million worth of RDTs, as rapid diagnostic test kits, imported into Africa, only 1% is procured in Africa. So you can understand why during COVID, most of the foreign nations who manufacture these RDTs had to secure their nations and ensure that most of the solutions to COVID-19 at the time were kept for their people. And so in preparation for the next pandemic, it is very important, that Nigeria looks in that direction. And I must at this point recognize, the efforts of our government. A lot is being done. We've had the privilege of, hearing the Minister of Health and Social Services speak so passionately about his plans. And in our own little way, we've started in that direction. As you know, we've started localizing, we've started producing blood glucose meters and strips here in Nigeria, being the first IVD factory for blood glucose meter and strip manufacturer in sub-Saharan Africa. And so, if I step back a bit, from where we're coming from, we've been importing medical devices and drugs into the Nigerian market. And of course, we all have said it here, Nigeria is still hugely import dependent. One of the major issues, of course, which we are experiencing today is the FX situation. And foreign exchange has a direct impact on the cost of products, of medicines to the end users, to the patients. We find ourselves, in fact, just yesterday, struggling to decide about the survival of our organization versus the survival of patients who were in critical condition and needed some of our solutions. And so, these decisions are very troubling to have at this point. In addition to FX, of course, we've talked about financing. I'm not going to belabor the point. But on this, I would just like to say that Codex and Stanbic IBTC recently crossed paths, and it's been a very enjoyable journey. We are hoping to see more in that regard. Financing still is a challenge, and with this, I would refer to the conversation around RDTs and PEPFAR's plan for Africa. So the plan, they've made an audacious goal to ensure that about $20 million, which is still small, but to start with, $20 million worth of RDTs are procured from Africa, from a local manufacturer in Africa. And we have started this journey to ensure that Nigeria is on the map. So when I say we've started, but we're not doing enough, a lot of the international conversations we've had with the global partners around securing, Africa and ensuring local manufacture, we've had very little participation from Nigeria. And I think this is a call, to all of us here that there's a lot of opportunity and there's a lot more that we can do to change the scenario. We need to be more represented in some of these global forums. I was in one with the WHO, and Codex was the only Nigerian company and person represented, at that meeting. So we need to do a lot more in preparation for the next pandemic. But we've started, and we are hoping that come 2025, Nigeria will be on the map as a hub for provision of IVDs, specifically blood glucose meters and strips, and RDTs in Africa. And then finally, the last point I would like to touch on will be, just as Mr. Omashe said, about our patients. And I've also said that FX, financing, they both have a direct impact on the cost of goods, of products, of medicines to the patients. And so it's very important to look at what more can be done. And one of the things I wanted to bring up here, which a lot of discussion still needs to be had around this, is how the financial organizations like yours, banks, the industry, and the bodies that form to provide support to patients, how we can collaborate, borrowing from Mrs. Omashe's presentation, how we can collaborate to ensure that our end users who may not be able to afford these very important medicines and medical devices are given the support that they need. So I started a conversation earlier on with Naomi, and we're looking at if it will be possible to, for example, and our area of strength is in diabetes, so I will speak around the Diabetes Association of Nigeria. So looking at the possibility of collaborating with that body to provide the needed diagnostic tools. For example, blood glucose meters, of course. Patients need to test regularly to manage the disease. But what we find is, even with local manufacturing, even with prices about 20% or more less than imported brands, patients still cannot afford these solutions. So it then speaks, finally, again to Ms. Omashe's last comment, that even though we invest, even though we put in all these funds, even though there's collaboration with the banks, and all of this is done, if the patients cannot afford these solutions, then it's an effort in futility. So these 3 points I was hoping to bring out here, and maybe in subsequent conversations I can speak around research and development and skill. Thank you very much.
Thank you. Thank you very, very much. I mean, healthcare financing has really come out quite a bit in today's session. And healthcare financing shouldn't be done traditionally. One of the ways you can also innovate is to digitize the financing process. And also see how you can also add value to get that healthcare business to also digitize. Dr. Bayomisule, you've done quite a lot in terms of empowering SMEs and coming up with innovative solutions, to see that they make money as well as contribute what they're supposed to be contributing. I would like to ask you to please elaborate on how more we can actually bridge this gap in terms of digital healthcare financing.
Thank you, Jane, for having me, and also for Stanbic IBTC. In terms of digitalization within the healthcare space, I think first principles for me is to go back to business model. First of all, in Nigeria at the moment, the business model for the healthcare is broken, largely because there is no sustainable revenue model. Most purchasers bargain on the basis of pricing. So a lot of organizations make their purchasing decisions on the basis of the lowest possible pricing. And when you have a broken business model or a broken revenue model, what you will have is input substitution, what you will have is loss of talent, what you will also have is poor quality outcomes as well. So we need to fix that business model. And to fix that business model, I think the private sector needs to put their money where their mouth is. They need to be willing to pay for healthcare services appropriately. They need to reward and incentivize quality as opposed to always pushing for lower premiums or lower prices. If you have the business model right, then perhaps we will not be talking about the need to have low interest rates. The healthcare sector will be able to stand on its own and play its own part appropriately as well. In terms of digital finance solutions for healthcare SMEs, I think, first of all, it's also very important for financial institutions to understand their customers and what they want and how they want to be served. I think so many times, because of the nature of our sector, we don't have financial institutions that understand healthcare as holistically as perhaps some of us who are players in that space do. We have peculiar needs. We require peculiar solutions. We require also, should I say, concessions in some regards due to the nature of our business. And again, I think it's also important to make the point that the healthcare sector is not homogeneous. So hospitals are different from pharmacies. Pharmacies are different from HMOs. We also have those who have manufacturing space. So it's not a one-size-fits-all for everyone within that space. You have to develop products that are fit for purpose. And the only way to do that is to speak to the stakeholders, know how they want to be served, know the sort of financing that they need as well. So, for instance, a lot of our customers, in addition to the introduction I was given, I also run a healthcare-focused financing organization, and we give out loans to pharmacies, hospitals, and clinics. And they tell us that the banks sometimes take up to 1 month to even tell them whether they qualify to take a loan or not. That's pretty too long. And sometimes they say even when they're told that they qualify, they might not get that loan maybe for another 8 weeks or 12 weeks. So I think the bank needs to fix that. I know there might be some regulatory restrictions, but there are ways to work around that. For instance, we are able to take a financing decision in 10 minutes with 2 data points. We'll tell you whether we can pre-qualify and tell you as a healthcare SME whether you qualify for a loan and how much you qualify for. So I think that speed of decisioning is very important. The bureaucracy in terms of also serving these healthcare SMEs, I think also needs to be minimized. So many times there are lots of documents that are asked for that might not be, should I say, important. I think we need to focus on serving them with minimal bureaucracy and also convenience as well and speed of service. So ideally, I think if you can give them a fast credit decisioning within 24 hours, if you can give them an offer letter within a week, if you can disburse within 2 weeks or maximum 1 month, I think the healthcare space will be better for it. But like I said, all this will be meaningless if we do not fix the business model, if we do not make sure that healthcare SMEs are viable by paying them appropriately what they deserve, whether in terms of HMO premiums or in terms of out-of-pocket payments. Thank you.
Thank you very much. This is where Mrs. Omashe's point around collaboration being the new innovation comes in. We need to collaborate more. There are businesses, or there are health techs that understand the healthcare businesses better than non-health institutions or organizations. And this is where we need to collaborate even better. Understand what the healthcare businesses want. Understand what the platform, the health tech platform wants to drive and how they want to deliver, and then we'll collaborate better. Last but not the least, let me borrow Moji's word, last but certainly, the payers. Now, Naomi, Bastion Health is a HMO. And if you come in that healthcare value chain, the payers are very important. These are the people that if you don't look after, they sort of vote with their legs and they fuel that medical tourism that we're talking about. In 2022, the government sort of put in place replace the National Health Insurance Scheme Act 1999 with the National Health Insurance Act of 2022. But we haven't seen that penetration in terms of access to healthcare insurance. As I speak, it's still, I don't know what, I think it's probably moved, but not significantly. It's still about 90%, 95%, thank you, 95% do not have access to healthcare insurance. How do we move that rate backwards? How do we penetrate? What should HMOs be doing better to sort of feel more integration? Thank you.
Thank you, Jane, for the question, and thank you to Stanbic IBTC for putting this panel together. I think first off, it's important to continue to have the conversations to create awareness and, of course, see how we can move the dial. So yes, we're talking about health insurance cover in Nigeria. It's very low. I know that Claire had mentioned in her slide, out-of-pocket payments and the fact that we can quickly, easily, get into some kind of financial catastrophe because we don't have it. If I asked in the room today, even for our domestics, a lot of us have domestics here. How many of us cover our domestics? We're still paying out of pocket for them. So therein lies the issue. When Doc spoke, he also said somebody was coming in on a stretcher to receive miracles. And I say to people, my major competition remains anointing oil, and it is not my portion.
How long?
So we have those nuances around the cultural beliefs and the religiosity of it. But then again, I say it is this same God who has given man knowledge and wisdom so that truly there will be healing from the doctors, the physicians, and all of that. But we don't have the awareness. I think that's one of the major issues, the lack of awareness. How do we begin to push awareness and advocacy around the fact that truly health insurance remains a major mechanism to funding, ensuring that you do have financial protection against sicknesses. There was a survey that was carried out saying 3 of 4 Nigerians in the last 5 years have had a medical emergency. Do we know what that means? It means truly that there has been some catastrophe because if you had a cancer or you had something of the sort, you're not seeking that medical attention because you're thinking, oh, my pocket. The other issue, of course, is around the behavioral patterns. We're all going to the pharmacist to get drugs. So we don't see the need to be able to take up insurance. But the major issue, of course, is the challenge around, of course, the awareness. So how do we as a health insurer begin to create a narrative that speaks to the importance of insurance and the need to take it up? Yes, we can say, oh, we're financing all these, the MRIs, on the supply side, but who is taking it up on the demand side? We need to also ensure that truly there are people paying for it. We have issues of purchasing power, but we need to also, as insurers, we need to begin to create products that fit. We make them bite-sized. We make it affordable and possible for people to be able to pay as flexibly as they want. Because right now we have most of the private sector signed up, but we don't have the informal sector as we should. And the informal sector contributes at least 65% or makes up 65% of, that market space, the SMEs, retail. So how do we drive it? Also, another challenge for us is distribution, and that is based on the fact that there hasn't been a lot of investment, even in terms of, ensuring we have the right distribution channels. When the banks did it with capitalization, you were able to drive a lot of technology. You were able to, drive your platforms. We also need to be able to do that. Drive through technology, the service, and ensure that, of course, distribution. But then again, we can do that through collaboration. If I'm collaborating with the Stanbic today through your platforms, you have about 6 million customers. Maybe about 40%, 50% don't have health insurance. How can we begin to bundle such products with your products to be able to distribute to, the masses or more people to take up health insurance? But yes, we need to create the awareness first for people to understand, because even in this room, a lot of people still understand the mechanism of how health insurance works. But we all need to push the agenda, like Jane has spoken to, which is the agenda around, of course, the last administration passed the National Health Insurance Act, which basically stipulates that every Nigerian, it's mandated that every Nigerian
have cover. And this is, of course, in line with driving the health coverage so that every Nigerian does have cover. It's not yet operational. Those operational modalities are being worked on, but I can tell you that in terms of the people driving this, both the government, even to the private sector, there's several meetings that have been had. The operational guidelines have been reviewed, and we see some state governments already driving it. So we believe that truly we'll be able to move that down. If we can move from less than 10 million Nigerians to even 30 million, that helps even in terms of funding for the sector, for people to be able to take up and, of course, consume health insurance. So it's work in progress, it's being done, but it starts from here, it starts from this room. And I think the challenge I would put here is that please, for even your domestic, get a health insurance plan so you stop paying out of pocket. But thank you very much.
Thank you very much.
Well said. Well said. I could agree with you more. There's a lot to be done. I was looking at some statistics around the percentage of out-of-pocket payments, and the largest percentage was actually coming from households. So, you're actually spot on. I will circle back to you, Mrs. Laoye. You have vast experience in how healthcare organizations should position themselves to be able to access healthcare financing. It's a risk that a financial institution would be buying. Anybody who's giving out funding or who is trying to finance this is buying risk. Which I would like you to sort of elaborate and also, sort of educate our audience. How should a healthcare business position themselves to be able to access healthcare financing? We know there's a ripple effect. Now we've been talking about brain drain, the famous brain drain in the sector. But you see, there's a ripple effect. When things are not going so well, that's when you also see the employees also looking for a way out. So I would just like to ask you, please, help us elaborate.
Okay, thanks, Jane. Actually, the probably perhaps where Dr. Shibule left off, and I was very pleased with the announcement today, which was around thinking about infrastructure funding, the way banks are now thinking about it, because certainly we have to first think about the different buckets of funding available and how do you match up that funding to the need of the healthcare sector. And really and truly, the healthcare sector has to be seen as infrastructure, as part of the infrastructure of the country, almost in the same way as you think about, large power, large developments, roads and all the infrastructure, because there's still so little, because the gap is still so wide. And therefore, we have to start to say, okay, how do we bring healthcare to that thinking so that hopefully we can see more long-term type of funding? Doc mentioned about the fact that Stanbic is going from 100 billion to 300 billion. I'm extremely excited to hear, that tap is now more open. So once we can see that kind of funding is available, then we can start to see how do healthcare businesses prepare themselves for that kind of financing. Now, largely, infrastructure financing would need to match infrastructure. So it does mean bricks and mortar, it needs equipment, it needs maybe to some extent kind of pharmaceutical R&D that can be, looked at as capital, as capitalized. So you have to make sure that we really understand our numbers in terms of what do we require, what is the cost of those bricks and mortar and so on. How can some of those costs be, to some extent, shared? So either because we are now bringing to us real estate developers, for instance, who are ready to do the real estate while we come in with so that it makes sure that the return is more attractive along the chain. So that's infrastructure side that we can present ourselves to the infrastructure funds. Now, what would the infrastructure funds be asking for? So we have to educate ourselves to understand, to be thought through as infrastructure. What would the infrastructure guys require? Certainly, they require, as with all banks. In this case, they require collateral. We can also think about credit enhancements now. So how can we find those who can not just give us collateral but can also enhance our credit worthiness some way so that again we are more can access more and we are more attractive. In addition to that, of course, there's always track record we done before. What sort of, as Dr. Sule showed, you have even the small, quick businesses who access loans. You want to see that they've paid back, as quickly as well, and then they can come back for more. So track record is important. What is our financial track record? What is our governance? What's our governance like? How are we set up? Do we have proper accounts, written? Is our business documented? Do we have a board of directors who are there governing? Do we have a proper management team? Even as small as your business is, all those things are so important just to show this will collapse tomorrow. One that at least once that investment comes in, it can continue to boost what is being done. And then, of course, even back to that, we have to still keep thinking about what I'll call working capital and how to separate working capital needs from the large sort of capital expenditure. So while infrastructure funds can be used to support capital equipment and so on, you have to think about working capital when it comes to the day-to-day cash flow. I mean, everybody is suffering from the FX situation, and it has become a liquidity situation now for all our businesses. It's not as much a profitability one now, it's more a liquidity one. And therefore, working capital is important to ensure that there's still enough to be able to continue to turn around and pay for whatever it is that you're paying for on a day-to-day basis. Now, of course, that also brings into the consideration, as you said, talent. In fact, in healthcare, I sometimes think that we should look at talent as part of our infrastructure, because really and truly, we are training, especially in the private sector. We are now really bearing the cost of training, because with the more the japa and the more we're bringing people on, we are having to invest in the gap, the training gap that is getting bigger and bigger. And I always often say, who's paying for that gap? We're making our patients pay for that gap, or are we going to find a way where we can capitalize that gap truly and make sure that it is adequately funded? Now, there is funding, yes, from lots of international partners. I've now realized that this training need is critical, both in public and in private sector, and there's a lot of support coming from there. So it's important to prepare ourselves and position ourselves. If I look at what we've done at Iwosan Lagoon, for instance, on the training side, we are now training house officers. So we're now accredited to train house officers. We're accredited to train nurse interns, pharmacy interns, and so on. So we have now, we have about, I would say, a portfolio of about 40 trainees in the different sort of healthcare areas. And it means that we have to support that, not just with funding, but also with the whole process for training and making sure that they are being well supervised. There is a lot that can be done in terms of partnering when it comes to training. And we are now already partnering with youth, for instance, to come together to put together proper residency programs that can now be accredited and that fellowships can be given. So that way we are increasing the training pool that is available in country, and hope that that helps to stem some of the flight. But as I said, there's a cost to it. So you have to bring that into your investments and into sort of, what you position when you're looking for funding.
Thank you very much. I think she deserves a round of applause, ladies and gentlemen. That question was deliberately kept at this point because it's important to understand how we can move the sector forward. We have managed to merge two questions, and our great panelists have actually answered 2 questions or 4 questions, originally meant for 2 questions. So
I would just quickly go round. Final word from each of us. Final word, something to take home with. I'm standing between tea break and the people, and I can see the eyes. So please, final word. I would like to start.
Okay, so I mean, for me, as Bastion Health, I think my mandate is really to drive health insurance for all Nigerians. And no better way to do this than collaborations and partnerships. And I think with Stanbic IBTC, given the platforms you have, we can do that, a whole lot of it, even through the telcos as well. But it's really to drive health insurance. That remains the funding mechanism to ensure that truly we're all covered. Our fundamental human right, is met and in line with the SDG goals as well. So really collaborations and partnerships are critically important for us as Nigerians.
Right.
Thank you.
Right. Thank you very much. Mr. Mashe?
Thank you. For me, I will ask everybody to go back memory lane, this time a few years ago, and let's together not waste a crisis. We all saw the importance of healthcare. It's not just about saying health is wealth. Health is definitely what is directly responsible for our existence. So we have a collective responsibility to be an ecosystem builder. As a stakeholder in the healthcare space, we need to collaborate with each other and find the short, medium, and long-term things. For the bank, I think as we're talking about collaboration, we need to do more collaborative financing. You need to be an ecosystem builder in your own space. You need to prioritize healthcare when you go to the bankers committee and get us long-term, preferably single-digit, patient capital for our patients. And in that order. And as Fola said, it's not everything for everyone. So a small business does not need what large businesses require. But Nigeria, most of our business, 70% of our business are MSMEs. So we can get financing in the healthcare space that is developmental in nature, find all the partners internationally, do a bouquet of solutions. What do you call it now? When you blend the finance. So, and then use other methodologies like partial risk guarantees. Partner with those of us in the industry that have the track record. JNC represents 27 OEMs. For each of those OEMs, we have various solutions. The challenge is that they're dollarized. We cannot offer our clients long-term financing in dollars, especially in the last 1 year. It would be suicide. So again, we need to find solutions that we can hedge the risk. But this can only be done by the bankers committee, the government, and the likes of the Healthcare Federation coming together to find solutions that are homegrown, that are long-term in nature. But we need to be able to change that narrative together. Thank you.
Thank you very much. Mary?
Thank you. So she just took some things from my thoughts. So we've started this journey with Stanbic IBTC. For where we're going with regards localization of RDTs, commercial loans, especially now that those funds are beginning to shrink when you look at the FX situation. I think that Mrs. Omashe's comments are going to be very helpful if we can look into this, bring manufacturers together, bring the healthcare sector together and look for financing. We know that the African Development Bank, for example, has from the feedback we received about $30 million, which is far higher than what we as an organization need at this moment. But if you can have a collection of other players within the industry who can tap into those funds, it will go a long way for everyone. The only other thing I would just like to add is we should also look in the direction of skill development. So we are localizing. We don't have the skills that we need for this innovation in Africa at this moment. And I can say a lot about this, but collaboration with our academia, with the educational institutions is very key in this. So if Stanbic IBTC can look into these two areas, I think that we'll be heading in the right direction. Thank you
very much. Dr. Sule?
As a complement to all that has been said about collaboration, I just want to highlight that only independent people or parties collaborate. So make sure you bring a product or a value proposition to the table. A bank or a partner is not going to solve your fundamental product development problems. You must figure that out on your own. And the only way to do that is by executing, iterating, and then refining your solution. And then when you've done that and you have some mastery in a niche, come to the table, you certainly find people who will be willing to partner with you.
Thank you very much. Well said. Mr. Going.
All right. Well, I'll speak for pharma. Like I mentioned earlier, I think the pharmaceutical industry has really advanced. They're well prepared and they're ready. Now, just for folks that may not know this, we do have a major drug security challenge. 70% of the drugs in this country is imported. And I'm sure most of you also know that a lot of the big pharma multinationals have also exited, right? So I think it's imperative that we come up, just like Claire said, and very quickly, so with creative solutions that will help catalyze local manufacturing right now. If not, the little capacity and capability that we have will be eroded. So that will be my parting words to folks like Stanbic IBTC.
Thank you very much. And to Ms. Lawi.
Okay. I would say start with the end in mind. I chatted with Doc earlier, and I asked how far is Stanbic willing to go in investing in the healthcare space. He gave me a number, and I won't say the number here, but it was a big number, and I was quite, excited to the idea that that sort of investment could come into the space, because we have all talked today about how catalyzing financing is. So I would just say to Stanbic that if you really put that number down, and say in how long you want to get there, how much of your balance sheet you're willing to put to the table, then we've got to start now and start, this is obviously one key way, the discussions, but we've got to take it beyond discussions and figure out all the steps that we need to put in place so that it materializes. But thank you very much.
Thank you very much. And with that, ladies and gentlemen, it's been an absolute pleasure talking to our distinguished panelists. And I also believe that you have found it very, very valuable. Thank you very much. That would be it for this morning.
Thank you very much. Please, a round of applause for our panelists as they wait for a group photograph. I'll also invite Dr. Dimola Shogunle to join them. Thank you. That was robust. It was thorough. It was insightful and very enlightening. Thank you very much for taking time to do justice to our conversation today. Now, just to inform everyone in the room that we will go on a quick tea break, not now. I would announce when that would happen, for 10 minutes. But that's not the end of today's breakfast session. We'll go on a quick 10 minutes break. We'll network, have tea, light bites, and come back into the room because we have a very important presentation that will happen. We have a specialized solution talk where we tell you about our service offerings and product offerings to address these healthcare sector challenges that we've been talking about here. And that would happen, and I think that's very important for us to listen to. So please don't go from tea break. Please come back into the room. And I'm certain that our stakeholders in the room have questions. So we'll have a time dedicated to a few questions and we'll provide answers to those questions as well. Now, in the case that we are unable to take your questions, we have email addresses that we will provide that you can send your questions to if you want to direct to any of the panelists, and we promise to provide responses to those questions. So right now, I will ask that we break for tea for just 10 minutes, please. 10 minutes, and it would happen right outside the door. We have hostesses who will lead us to where it would happen. So please, let's break for just 10 minutes and return to the room. This is not goodbye. It's just a quick break, 10 minutes, and we'll return to the room. Enjoy your tea break. I will see you at exactly 11:44. That's an additional 1 minute to allow you return to the room. At 11:44, please let's return to the room to wrap up this conversation and, of course, take questions, and we will provide answers to them. And when we are not able to, we will send you an email where you can send your questions to, especially if you'd like to send to specific panelists. But thank you for joining us, ladies and gentlemen. Please enjoy tea break. If you need help locating the tea break area, you can speak to any of our hostesses who are right by the door. We will see you in now 9 minutes, 30 seconds. Please enjoy your tea break. Let's return to the room in less than 10 minutes now.
I care for 5 good years you have been in this shop. If it is to update your WhatsApp now, you will know how to do that one very well. Okay, abeg, no vex. Your money na 780,325 naira.
You no get person wey sabi everything for business. Market na teacher, trader na student, hand wey sabi na hand wey learn well.
You can pay to my accountant with our Stanbic IBTC POS. It go one time.
Business no be wetin one person fit do alone, because market na community. E dey work well when we join hand with people wey sabi business well well.
You outdid yourself. This dress is given.
Because na who get better hand of support go get better business. Everything for business na kparakpo. If correct business like Stanbic IBTC SME Collab Hand join your own with loans wey you go get, free business training and support, e sure say you go do big things. For Stanbic IBTC, we dey join hand with business people take grow their business. Go for growth with Stanbic IBTC for Enterprise Direct at stanbicibtc.com or call 0700-333-3333.
There is nothing like one-man business. One creates an ecosystem of products and services. Another supports. One plants. Others harvest. One ships it, and another collects it. One seeks answers, the other prescribes solutions. One man produces, another consumes. There is nothing like a one-man business. Business is finding the right partner that goes all the way with you, with answers that lead to your business growth. Find your growth partner with Stanbic IBTC. Go for growth with Stanbic IBTC.
I care for 5 good years you have been in this shop. If it is to update your WhatsApp now, you will know how to do that one very well. Okay, abeg, no vex. Your money na 780,325 naira.
You no get person wey sabi everything for business. Market na teacher, trader na student, hand wey sabi na hand wey learn well.
You can pay to my accountant with our Stanbic IBTC POS. It go one time.
Business no be wetin one person fit do alone, because market na community. E dey work well when we join hand with people wey sabi business well well.
You outdid yourself. This dress is given.
Because na who get better hand of support go get better business. Everything for business na kparakpo. If correct business like Stanbic IBTC SME Collab Hand join your own with loans wey you go get, free business training and support, e sure say you go do big things. For Stanbic IBTC, we dey join hand with business people take grow their business. Go for growth with Stanbic IBTC for Enterprise Direct at stanbicibtc.com or call 0700-333-3333.
There is nothing like one-man business. One creates an ecosystem of products and services. Another supports. One plants. Others harvest. One ships it, and another collects it. One seeks answers, the other prescribes solutions. One man produces, another consumes. There is nothing like a one-man business. business is finding the right partner that goes all the way with you, with answers that lead to your business growth. Find your growth partner with Stanbic IBTC. Go for growth with Stanbic IBTC.
We had spoken a lot about how Stanbic IBTC has played a very vital role in supporting the healthcare sector. We do have results to show for it, and we have someone who will join us very shortly, virtually, to speak to us about his experience. So this is a customer testimonial, and this will be delivered by the CEO of Cedar Crest Hospitals Limited, Dr. Felix Ogedegbe. Technical, can you please? Oh, great, he's already on screen. Hello, Dr. Felix. Let's give him a round of applause. Dr. Felix Ogedegbe will be sharing his experience relating with Stanbic IBTC, because we have said and re-emphasized and reiterated over the course of this event that Stanbic IBTC is very particular about the healthcare sector, and we have collaborated, we have sponsored, we have partnered with, we have funded several initiatives in that regard. We'll be listening to the CEO of Cedar Crest Hospitals Limited, Dr. Felix Ogedegbe. Good morning, sir. Thank you for joining us virtually. We're truly happy to have you. I will hand over to you now as we listen to you. If we can please take our seats very quietly and listen to Dr. Felix, that would be nice. Over to you, sir.
Thank you very much. I hope you can hear me clearly.
Hold on, Dr. Felix. We just want to make the audio a little louder so everyone in the room can hear this beautiful testimonial you have to share.
Thank you.
Let's try it again, sir. Hello, Dr. Felix.
Hi, good morning. I hope you can hear.
Good morning. Yes, we can hear you loud and clear. Please go ahead, sir.
All right. Thank you very much for inviting me. Very many thanks, Jane and her wonderful team for organizing this and for having me to be able to join. I have been listening intently. Testimony, or we are a testimony incident. The Stanbic IBTC have made in healthcare. And I think going ahead to host this breakfast session does show that Stanbic is ready to launch fully into the healthcare space, quite in line with a lot of the areas and discussions that we had this morning. Will your IT team be sharing my slides? Or I just talk through them?
Yes, Dr. Felix will share your slides and you can still talk through them.
Thank you. Okay, so would you just let me know when the slideshow has started?
Not a problem.
Right. Thank you very much. So next slide, please. So our engagement with Stanbic had happened some years ago, but I think in the post-COVID era, we got in touch with Stanbic again sometime last year. Cedar Crest has been in Lagos for a while, but we had thought of having a full-fledged hospital on the island. And shortly after the COVID-19 broke, we all know that the federal government of Nigeria, through the Central Bank of Nigeria, did ask for those who were interested in healthcare investments to say so, and we were one of those who got some funding from the Central Bank of Nigeria through Fidelity Bank PLC. And so we started this project, a 55-bed specialist hospital, mainly going to be focusing on orthopedic surgery and related specialties, hoping to be able to bring world-class care to the Lagos area, and also provide an avenue to get inbound medical tourism into the country and into Lagos. Next slide, please. Next slide, please. Yeah, so again, our emphasis in Lagos is really to do orthopedics and everything that makes it work. We believe that this should be a good addition to the Lagos healthcare space. Next slide, please. So this was how we went, using the CBN Fidelity funding. We broke grounds in August 2022, and by March 2023, of course, we know that the issues with funding and depreciation and the inflation didn't start today. They had begun to take a toll. So the budget had actually gone beyond what we thought of initially, and we had spoken to a couple of banks at that point, and
recording in progress.
Luckily, we got introduced to COVID to Stanbic, and we were quite amazed and delighted by the reception that Stanbic gave us, and Stanbic stepped into the project at this point. So by March of 2023, which is less than a year ago, not a lot of progress. A lot of progress has been made, but we're at the point where we needed some intervention and funding to be able to proceed. Next slide, please. So the intervention from Stanbic came up and by November, barely 6 months later, we're already getting to the completion phases of this contract because of the intervention that Stanbic PLC made in our project. And by January 2024, like you can see, the fact that we had funding in there and the fact that we already had some presence in the city made it very, very fast for us to be able to scale up to the point where we are now. If you go to the next slide, you would see that the building is virtually completed. We are beginning to fit equipment into the building. We are at the point where we're going to be starting full services in this location in a very short time. So I would say that yes, these are just the front views of the building, and the earlier ones were the pictures from the inside. So I would say that we've actually found Stanbic IBTC very good partners. They've been wonderful banking partners. Of course, we've dealt with other banks before, but I think the fact that they brought the intervention they did at the point when they did in a quest to bring this project to fruition, they've actually worked with us thereafter, looking at various aspects of our business. I'm quite glad now that we are, doing this breakfast meeting. I believe that from all that has been said, that Stanbic wants to take a deep dive into the healthcare space in a very big way, and then begin to do more in the healthcare space. I'm just ending up with this slide, putting up the range of services we do. Abuja is a multi-specialty hospital. That may not be a very clear slide, but we do offer a range of services in all aspects of medicine. And we say that we treat local patients from, we've also begun to see foreign patients, both from West Africa and beyond, coming into Nigeria for care. And we hope that once the right investments are made and the right conversations about health insurance, about people being able to pay on the demand side, I'm sure that the healthcare industry will at some point begin to rival the financial industry, and we'll all be better for it. I will stop at this point. Thank you very much.
Thank you very much. Please let's give a round of applause to Dr. Felix Ogedegbe. Thank you, sir, for taking time to share this beautiful testimonial with us. It's very encouraging, and we're truly delighted at what Stanbic IBTC Bank is doing in the health sector, especially positioning as a trusted growth partner in this regard. So thank you very much again, Stanbic IBTC Bank, for putting this together. We will move on very quickly without much further ado, and we will have a specialized solution talk. Then we will take questions and answers after this presentation has been done. So at Stanbic IBTC Bank, we do have bespoke solutions tailored to the unique needs of the healthcare sector and, of course, the entire value chain. So this presentation will speak to that, and to do the honors, it gives me great pleasure to make welcome again Jane Ike Okoli, the head specialized sectors at Stanbic IBTC Bank, for this presentation. After that, we'll take questions and answers from our stakeholders in the room, and then we will take the closing remarks. Thank you for coming, ladies and gentlemen. I'll hand over to Jane Ike-Okoli, who will steer this conversation and help with the presentation. Over to you.
Thank you very much, ladies and gentlemen, and thank you even more for your patience.
Recording stopped.
I would start with calling one of our very special product houses, Jemitola. Please, can you come up stage? Tai works in our global markets unit, an expert in coming up with different FX solutions, and one of our very, strong areas, in Stanbic IBTC, Tai. And just after Tai, I would like to call on Emmy Agaba Oloja. Emmy works in the Stanbic IBTC trustees arm of the group, and Emmy is the executive director in the subsidiary. Thank you, Emmy. Please give them a round of applause. Thank you. And Ifoma Abdul is a special. Ifoma Abdul is a specialist in the trade finance solutions. She would also be speaking to our trade finance solutions available and how they can help support the healthcare businesses. And last but certainly, we would have Tina Mbagu. Tina comes from our Stanbic IBTC Asset Management. She would be speaking to the different investments that the healthcare businesses can also leverage in, moving their businesses forward. Can we have chairs, please? Thank you very much. All right, thank you. Tai, do you have a mic? All right, so just to get right into it, Tai, what has been established today is one of the biggest challenges in healthcare sector, which is healthcare financing. And I'm sure in the course of the discussions, you must have heard that, the key players in the healthcare sector, healthcare value chain, are heavily dependent on importation. Now, given the current situation in the country, can you please just share your thoughts on how the businesses can position themselves, to manage the situation as well as move their businesses forward? Thank you.
Thank you. So when we're talking about trying to position yourselves in terms of importation, sometimes there are issues with regards to interest rates, because the first thing you need to look at is what is the issue I have in terms of importation. Is it an interest rate issue that I have in terms of the loan that I have taken, or is it an exchange rate problem with regards to maybe a foreign currency loan? And with regards to that foreign currency loan, are you looking to mitigate the exchange risk that you have or the liquidity risk? So you can look at it in 2 or 3 folds: interest rate issue, exchange issue, or a combination of both. So in terms of interest rate issues, we've seen inflation getting elevated. Inflation is currently at around 29.9, and the MPR rate, which is the monetary policy rate, that's the rate at which the central bank would lend funds to banks, and banks would use that rate as a benchmark to also lend to their customers. So they will lend at the monetary policy rate, which is currently at 18.75%, plus or minus a spread. With that monetary policy rate, we've seen that the rates, because central bank also uses that rate to control inflation in terms of how do they need to moderate inflation?
We might need to moderate a bit, project a bit so we can hear you.
So in terms of how do they need to moderate inflation rates, So next week there is an MPC meeting, which is Monetary Policy Committee meeting, and it's expected that the rates are going to get elevated again by maybe about 2 to 3%, which means MPC rate is going up to maybe about 20.75% to 21%. And with that, it means that importers are going to be borrowing at a higher rate. So the reason why I'm saying this is that, are you looking to cut your interest rate cost if you are a borrower? If interest rates are as high as, let's say you're borrowing at 23% now, it means that you should be looking at mitigating that cost. You should be looking at trying to cut the cost on your interest rates, which means this is the best time to do it if your view is that interest rate will continue to get elevated. In terms of exchange, and there are products around interest rates that you can use to solve for that issue. Then in terms of exchange rate, we've seen where exchange rate is right now. Exchange rate has gone up by over, I think, 300% from between last year and this year. Currently, we see it at around 1.7. At the end of January, it was at 1,300. It was around 1,300, but today, as we speak, is around 1,007. If you borrow in foreign currency, and at the end of the day you need to convert that foreign currency to pay your lenders, you should definitely be looking at hedging that exchange risk or liquidity risk. And there are products around how you would hedge that exchange risk or the liquidity risk. There are different products to mitigate against such exposures. So that is why we're here speaking to you. So some of those, some of the products that you should be looking at in respect to hedging exchange risk are products that would help you save some of the flows that you need to, would help you, that is cost saving on exchange. So there is a product called a non-deliverable forward, which you can use to mitigate that exchange, or you can do a cross-currency swap, which means that if you're looking to maintain your liquidity in terms of having to pay back in the future, and you don't want to exchange, so that you just have that particular foreign currency to pay back, you can go into a cross-currency swap. There are also other products that you can look at. That is in terms of trying to manage your cash flow management, which gives you certainty of how much you're going to spend now or in the future. So those are the types of products we look at. I don't want to take so much time because how many minutes do I have?
Thank you very much, Tai. Well said. This session is really important, and I'm very sure you're noting down your questions. The Q&A session is coming right after now. So please keep listening and keep noting down your questions. I would like to go to Ifoma Abdul. So Ifoma, importation has really surfaced a lot, especially on the producer angle of the value chain. So there's it's also a challenge, but I would like you to just share the trade finance solutions, that are available, to help mitigate the risk of even, cross-border payments, as well as accessing healthcare financing, which is also the big elephant in the room that we've been addressing all morning. Thank you.
All right, thank you, Jane. Good morning, everyone. For trade finance, we will be speaking about the trade finance opportunities that are available, that help facilitate your cross-border payments, your imports or export for clients that are in the export space. There are quite a number of them. You can go with your letter of credit or bills for collection or telegraphic transfer, and a whole other products that help mitigate the risk of importation across other countries. For example, if you decide to employ the use of your letter of credit, it's one of the most secure methods of payment, actually, and it helps mitigate against the risk of maybe your supplier not delivering, or the supplier having fears that once he sends his goods, he doesn't get paid. So the bank steps in and provides that guarantee that both the importer and the exporter will require, for their products. So there's several other products that come in that way that actually help secure your cross-border payments and provide that security that you require. Speaking to the other solutions that are available in terms of financing for your international trade business, we have the LC confirmation line. That's actually an FX-backed transaction. And for now, because of the FX situation that everyone is aware of, and I'm sure my colleague has also spoken on some FX solutions that can help mitigate the risk. We kind of limit it to clients that have FX receivables or have some form of FX backing, to avoid the fluctuations and to mitigate against the FX risk. And then we have our Naira import finance facility that we also offer to our clients. In that case, you can get Naira and then go ahead to buy your FX either from the bank, or if you have the FX, then you use the Naira to buy FX and cover your import. All right, then we have other short-term loans that you can use for your duty payments, for your clearing, and for those that are expanding, we have other facilities available, for importation of your medical equipment, for your machineries, for vehicle and asset finance, for term loans that you can use for your expansions. So that being said, there are quite a couple of offerings that the bank has. But what we do is we try to sit with you and analyze the business and see what best suits your business, so that you don't take on more than what you should be taking, and you don't get yourself trapped somewhere along the way. So, but that being said, Stanbic is here to support the business of healthcare. It's one of the major sectors that we are focusing on, and we're here for you. Thank you.
Thank you very much, Ifoma. We're not forgetting our online audience. Please keep dropping those questions. Those questions will eventually get to the experts that would answer them for you. One of the things that we leverage on in Stanbic IBTC is our structure. And our structure and what we know, what we have been known for, which is an end-to-end financial services provider. And one of the subsidiaries which is leading the market is our Stanbic IBTC Asset Management. Tina, you would please just elaborate on how different investment opportunities can also serve as a weapon, right? Or as an opportunity for our healthcare businesses to access financing. Thank you.
Thank you so much, Jane, and thank you everyone for making our time to be here with us. At Stanbic IBTC Asset Management, we have various products, both for individuals, corporate organization, all tailored to meet your investment needs based on your risk profile, liquidity requirements, and also investment objective. At Stanbic IBTC, like Jane said, we are one of the few institutions that maintain an end-to-end financial solution. At Asset Management, we have various products, that will suit the healthcare sector. But I want to just focus on one of our key products, which is our flagship product. It's called the Stanbic IBTC Money Market Fund. Basically, it's a mutual fund. What does it do? It helps you as investors or as healthcare providers to save whatever amount, that you have, probably for liquidity provision or for operational use in the investment account. And at the end of the day, the fund provides you a decent return. Currently, our money market fund is at 12%. And with the money market product, you can also use that as what is it called? As a collateral for your investment, both on a personal level and also on a corporate level. With that, it kind of reduces your liability cost. You can imagine you borrowing at for a smart loan for the individual at 19% and your investments being at 12%. So basically, it just reduces your cost. We have various products, but I'll just focus on that. And what we preach is the solution that we're bringing to the table. And we can only provide that solution when we sit at a round table to know how Stanbic IBTC can service you better. Thank you so much, Jane.
Thank you very much, Tina. One thing I love about Stanbic IBTC Asset Management Solutions is also the Stanbic IBTC Dollar Fund, which we have seen the different healthcare businesses that have come to talk to us sort of leverage on. It has turned out to be a two-edged sword, where it's also where it's serving you in terms of accessing that healthcare financing that you need in Naira, as well as you getting your return. So, I mean, I think it's something worth exploring, and I think it's something, worth taking on. And still on leveraging the Stanbic IBTC holding structure is our Stanbic IBTC Trustees Limited. And Amy would sort of educate us on the different, or how the trustee business is sort of solutioning for the healthcare sector, and even down to its employees as well. Amy?
Thank you, Jane. Good afternoon, everyone, and thank you for being here. So for the trustee business, a lot has been said around loans, and what happens most times for you to get or access any loans, you need to have the collateral. Now, what happens most times is that people take the only collateral that they seem to have and go to a bank, and that collateral is more or less tied to that particular bank, and they get some resources from the bank, even though the collateral is more sufficient to cover certain costs or setting more loans that they can take. But with a security trustee function, what happens is that some capital trustees will act as security trustees. We can either do a mortgage debenture, where you have real estate as your collateral, or we can do an all-asset debenture, where you have other items in your facility to serve as the collateral. So what happens is the trustees hold that asset. They hold the collateral, where security trustees will hold it. And whatever facility you have from any bank, if there is a need for you to secure additional funding from another bank, you don't need to go and start worrying about anything. The other bank can then access that same facility and give a portion. So instead of just tying down your assets to one bank, which is what most people do, they just give everything to one institution, and then they are stuck because the institution may not even want to expand the facility they are giving you. But with the security trustee arrangement, we're able to assist you, and you can have additional lenders come on board with that facility. Now, for you as an individual, succession planning is also key, and it's important that you consider that. What measures are you putting in place to ensure that there is a continuity of your business? What happens to you if anything happens? What processes have you put? Some people will say, you know what, I'm the brain behind this business. If anything happens to me, ensure that there is a venture capitalist, the company is sold or whatever. But it's important that you begin to think about succession planning in your spaces. For yourself as well, it's important that you also protect your individual assets. You can either set up a trust where you transfer the assets to a trustee to hold in trust for beneficiaries, of which you can be, or you can have your will put in place. Some people will say, oh, like, I think it was what's her name, that was mentioning to say, anointing oil is not my portion, God forbid, all that. The only thing that we're guaranteed is tax and debt. So it's important that we put these things in place. Take out a life insurance policy on yourself, nominate your family as beneficiaries. You can even put your will in place for your employees as well. Some people will say, oh, we really don't have anything as employees. But they do have a retirement savings account where contributions are being made. They do have a bank account that payments are being made. Some of them even have mutual funds investments. So you can put in place a simple will for these people. It's elective. People will take on those services. For yourself, you can do a comprehensive will, put all your assets into one structure, nominate it, state it out clearly what your wishes are, so that when the event does happen many years from now, your assets are secure and your family will be grateful that you did leave a legacy behind. Thank you, Jane.
Thank you very much, Amy. Ladies and gentlemen, I'm very sure you found that very, very informative. I will open up the floor for questions. I know you have a lot of questions on your mind, but because we want to respect your time, we appreciate the fact that you first of all defied the rain and you've been here all morning. We will take just a few questions. If you have any questions, please feel free to raise your hand. We could also pick up questions from our online platform as well. But here is the time. Thank you. I see a hand at the back.
Hi everyone, good afternoon. My name is Jenny and I am the CEO and founder of Clafia. We are a digital healthcare platform based in Nigeria. And I just wanted to know more about partnerships that Stanbic Bank is open to doing with tech entrepreneurs in the digital healthcare space, and who do we need to approach and to foster those relationships and partnerships? Thank you.
Thank you very much. I am very glad to answer that question. First of all, you're looking at the person who is talking. I'll be the person that you would be talking to. Are we ready? Yes, that's the answer. We are already partnering with health techs that understand the healthcare business even more than we do. We believe in the power of collaboration. We believe in the strength that the health techs bring to the table. We leverage those strengths. So the answer is a big yes. So please, we'll see after the thank you so much. Do we have any other question? There's a gentleman on the other side. There's a hand.
Good afternoon. My name is Prince Degun Aguade. I'm the MD of Ofema Pharmaceutical Industries Limited. We are manufacturers of medicine. Let me first of all thank IBTC for the invitation. We didn't apply to open a bank account with IBTC because we have other banks. So we got a call that we can just come up and then somebody will visit us, and that was how it started just a few months back. Okay, so that's number one. The second point is, as you may be aware, in manufacturing of pharmaceuticals, only manufacturing in Nigeria today, 99.9% of what we use, inputs, are imported. And in the current circumstance, I want to ask if there is any window or arrangement that you make with your customers, that is, we users of foreign exchange, to soften that area. Even we have other banks that we operate with, getting foreign exchange is still a problem. And if all that, even if the only thing, the only 2% that we don't import is water, and we need chemicals to treat the water. The chemicals will be imported. So virtually everything is imported. So I just want to ask if you have anything like a program or a window, just to say, okay, you give me naira loan. I want foreign exchange. I don't even want to touch the naira. What I want is to open an SC, tell you what I want, and all that. Is there anything like that? Thank you.
Yes, sir. Thank you very much for that question. I would throw that question to Tai Tai. She's already picking up her mic. Yes, please. All right. Do you want to ask your question so we can take it? Yes, please. Please go ahead. Yeah.
Thank you very much. My name is Felix Abegunri. I'm the CFO of Ofema Pharmaceutical. The question I just want to ask is to Tai Tai, right? When you were talking about interest rates, you said that the business should strive to, as much as possible, to cut down their interest expenses, something like that. I want you to expand on that. How we be able to reduce our interest expenses? I think you get the question. Thank you very much.
I get it. Okay, so, can you hear me now? Okay, so with regards to the exchange, you wanted to know if there is a window where FX would be sold to clients. Okay, right now there is a glitch in liquidity, that is FX. What the CBN has done is to bring out some reforms So they're working on reforms, and they've actually sent out some reforms into the market to standardize the market. So with regards to the reform, some of the reforms that they did was reform on net open positions of banks. Net open positions of banks is the amount of FX liquidity a bank can hold at any point in time. So they have standardized that to say, and it's usually a function of your shareholders' funds. So right now, what they've done is that no bank can hold any position, a positive position in terms of FX. So if you have FX, you must sell everything to 0 or to 20% negative of your shareholders' funds. This means that if your shareholders' fund is, let's assume, $10 million, which means that you can sell what you don't have up to 20%. That means that you can go down, I can sell to you up to $2 million negative. But I have to find a way to cover that position whenever I find FX. The reforms they've also taken up is with regards to interest rates. So if you look at the interest rates, you see that the yields on securities, that is on investments, has gone up. That's treasury bills. They're trying to attract both foreign direct investments as well as foreign portfolio investments. But you know how foreign portfolio investors are. They want high yields and they want high returns on the foreign exchange. So we've seen the foreign exchange go yo-yo. It's been going up. And yesterday we saw it come down slightly on the platforms. But another sector that we've seen that has huge liquidity in the system is international money transfer operators. That's the IMTOs, the likes of what you call Western Union or MoneyGram. They bring in huge inflows into the system. That's diaspora funds, and they sell to banks. But because of there was a peg which CBN has taken out, and that peg was to say that IMTOs, that is international money transfer operators, cannot sell or buy at more than 2.5% of where the Nigerian foreign exchange rate is. That is NAFEX. There's a benchmark we use, which is NAFEX. So that NAFEX was at a low rate. It used to be as low as 900, while the parallel market and banks were trying to sell at above 1,000. So definitely the IMTOs won't sell to you. So you had a lot of IMTOs, smaller IMTOs, and smaller brokers selling from desk abroad. They had opened a lot of desks everywhere and were selling at very high rates. So this is one of the things that the central bank is trying to curtail so that foreign exchange comes into the system. With regards to securities that I mentioned, that the interest rates has gone up, the securities that have come in, what they're trying to do is to attract, like I just said, to attract those portfolio investors. When the portfolio investors come in to invest in your securities, which is now as high as 19% on the 19% discount, which is about 23% yield. When they come in to invest in those securities, they bring in dollars, and the amount of dollars they bring in is a lot, is huge. So they'll convert these dollars to naira. That is the dollars that were meant to sell to customers who have eligible transactions like yourselves. So once that has been settled, the reform is going on, and I know that that reform is going to help the market. So once that is done, then we start seeing the changes. We're beginning to see some small changes, just like I said. If you look at the platforms as at Monday, Tuesday, Wednesday, you see that it got to as high as 1,900. But between yesterday and today, we're now beginning to see between 1.6 and 1.7. So it may take time because they have to curb all the nuances in the market, in the system. They have to curb all those nuances, but it's going to happen. So definitely we will start seeing liquidity. We're hopeful that something is going to happen very soon. Then with regards to interest rates, you mentioned interest rates. So it could be either local currency or foreign currency. You may have issues in terms, you may have taken a foreign currency loan. But you know right now, if you're not earning, if your receivables, that is your earnings, your revenue, is not in foreign currency, you can't take a foreign currency loan. So you have to, it depends on what your receivables are. If your receivables are mainly local currency, then you have to take a local currency loan. If you have receivables in foreign currency, then you can take a foreign currency loan. So if you're trying to hedge that cost, let me give you an example. If you have a foreign currency loan that you have taken, assuming you've borrowed at SOFR plus SOFR plus a spread, it's usually plus a spread. Let's assume your all-in comes to, let's say, 10%, and you're trying to hedge that cost. Currently, as at last year, we saw the interest rate, the Fed rates going up. It's beginning to go down. So this wouldn't be the best time. I think you should wait because we're expecting to see about 3 to 4 rate cuts. So once that goes down, then you can get into that particular event. That is to say, okay, I want to hedge my cost. Those who hedged their cost about 2-3 years ago are currently in the money because at the time they hedged, rates were less than 5%. That is, then it was LIBOR. LIBOR was as low as 3%, between 1% and 3%. And we have a lot of customers that hedged at 0.4065%. So they are earning, so what happened there was that the rate was at 0.4065. We hedged at 0.4065. Interest rates right now is higher than 6%. So they are getting the difference on 6% minus 0.4065% quarterly. So that is what they are banking. So they keep on banking that. So, but as the interest rate goes lower, the amount, the spread that they are banking would reduce. It's the same thing as Naira. If you hedged when Naira rates were as low as 12%, as at last year, we were talking between 10, 12%, 13% maximum. If you hedged as at that time, now interest rates are as high as 18%, 19%. I'm sure in some banks it's much higher, maybe 25%. If you had hedged at 12%, though the bank would take a spread, let's say 1%, if you had hedged at 12%, today I'll be paying you 19 minus 12% quarterly. You understand? So which means you're saving 7% on your borrowing because your borrowing will definitely be pegged to either monetary policy rate or the bank's rate. So that's what you would have been enjoying. So those are the things that we say you should look at so that you can have certainty of your cash flow. You know what you're starting out with from the onset and you know what you're ending with at maturity. It could be 2, 3 years, 4 years, or 5-year loan, especially for equipment manufacturers, as those who buy equipment. It may be a 5-year loan they take. So for that 5-year term, they can hedge that foreign currency loan or the local currency loan.
Thank you very much.
We have something from...
We have some minutes more?
No, something from someone online.
Okay, please go ahead.
So this is from someone watching via YouTube. Hello, Stanbic IBTC. Thank you so much for this session. Please, I want to ask the speakers, is the Stanbic IBTC lending solution able to cover the expenses of cutting-edge technological tools? Also, if I may ask, is the bank open to supporting the manufacturing aspects of the healthcare industry? What loan options are available to healthcare professionals, and what is the application process?
I can answer that. The simple, to start with, the answer is yes. Stanbic IBTC is supporting the manufacturing sector and, of course, the pharma sector. The pharma market is part of it, as well as the other tools in relation to healthcare. In terms of what is the process or how can you get, responsible lending would put down some down rules. We would look at your business, look at what your cash flow is. We would not want to give you a facility that will eventually kill you. That's what I always say. Responsible lending covers, objectively appraising your business, looking at your numbers, and also seeing how, your business can sort of comfortably repay without any stress. So we would, ask for your numbers, ask for your financials, see how your business is doing, and also listen to you, because we also believe that it's not a one-size-fits-all. So for every business, for every client, we believe that there is something unique about that business. So we would need to take a deeper look into your business and what your special needs are, depending on the pain points you want that facility to address. And then we would structure. So the answer is yes, but we would need to look into each application one by one. But the big answer is yes, which I think that's what the question is looking to get. Yeah. Do we have any other question? Oh, there's a hand at the back.
Thank you very much. Thank you, Stanbic. My name is Ayo Harriman. I'm an ophthalmologist. I run an eye hospital, and I'm a second-generation ophthalmologist. Now, it's just a simple question. To what extent are you willing to assist an organization like ours that has funds invested in asset management? To what extent, like the funds used in asset management, will they be used as collateral to a loan? Or, yeah, basically.
All right,
just a simple question.
Thank you very much, ma'am. That's Tina's question. Tina, do you want to speak to that?
Yes, the answer is yes. And it's a big yes. Because once you're able to put these funds aside, and you need to borrow, I think you can even borrow up to 80% of what you have with asset management. So it's a big yes for us, and we're willing to engage for that.
Fantastic. And then one more question. Moji, beside you.
Good afternoon, everybody. My name is Bola Ogidon. I'm the CEO of Pirano Energy. We're a solar company that provides solar solutions primarily for businesses on long-term contracts. And my question is around information. So we have a series of 10-year cash flows coming from our customers. We allow them to pay over a 10-year period. And so we have quite long receivables. And we are always looking for financing options across our banks. And we've been at Stanbic, we've been banking with Stanbic for approximately 7 years. So we've been with you guys for a long time. But the issue we've always had was we didn't know what different financing options we had and how they could be relevant to our business. So what is the best way in terms of information that we can get the information around the products that Stanbic has for the various needs of our business for when it comes to the lending side from Stanbic to help continue our journey on helping businesses save money on their power?
Thank you very much. And when you were speaking, I was looking out for Richard Inegbedion and Patrick Ene. Now the reason, Patrick is there. Patrick is right behind you, Moji. Thank you.
Thank you very much. Sorry, I didn't get the name again. Bola. Okay, Bola, thanks for that question. Obviously, you're in the energy sector, right? Providing renewable solutions, sustainability. So it's a focus area for us as a bank. We are willing to work with you, sit down with you, look at the receivables, and see how we can leverage the strength of the cash flow of those receivables and see how we can provide a solution around what you have and provide a product that will suit you and also suit your customers. So the answer is yes, we are happy to sit down with you. And I can't tell you this is exactly what we're going to do. Let's look at your books and sit down with you and find a solution that works for you. Thank you very much.
Thank you very much, Patrick. Well said. So, I mean, I think after this panel discussion, please, you would have more time to engage each and every person on this panel and in the audience, and the Stanbic IBTC, my Stanbic IBTC colleagues in the audience. One thing I would like to say, when Tai Tai was talking, One of the things that we pride ourselves in is the compliance level that Stanbic IBTC does not take for granted. We work very closely with the Apex Bank. We support the policies. We support what the Apex Bank and the government stand for. We also, at the same time, sort of, put a balance and see how our clients can also benefit from that, give them the best advice at that time. I would stop here. Colleagues, thank you very much for your time. Please feel free to engage them after this discussion, and you will get more. Thank you very much. I've enjoyed talking to you guys again. Thank you.
Thank you very much for taking us through this solutions product talk. We are now wrapping this all up. I will just like to announce that if you have any questions after this and you'd like to get an answer to the question, you can send an email to sectorsolutions@stanbicibtc.com. sectorsolutions@stanbicibtc.com, or you can email specialized sectors@stanbicibtc.com. So there are two email addresses you can reach out to if on your way home you remember a question you didn't ask. So sector solutions with an S, sectorsolutions@stanbicibtc.com, or specialized sectors ng@stanbicibtc.com. Thank you very much, distinguished ladies and gentlemen, for your time. I will now make welcome the head enterprise banking at Stanbic IBTC Bank to help with the closing remarks today. Round of applause for Olajumoke Bello as she helps to close this session today. It has indeed been a great, great day.
Thank you, thank you, everyone. Good afternoon, ladies and gentlemen, and to our viewers who have joined us online virtually, and to everyone in the room. It's been an honor having you in the room with us today. For me, it's been a very, very insightful and thought-provoking session. I think hearing from the panelists, the keynote speaker, and all the knowledge they shared with us has shown that it's just really important that we take the health sector and the development that is needed in that area very seriously, that we all work together. They did talk a lot about collaboration and strategic partnership. They talked about the financial solutions that are required in the healthcare sector, and that we have to be very creative in coming up with these solutions. We need to look at digitized offerings. We need to look at how we can support backward integration also. So a lot of things were shared, and we do appreciate and recognize the efforts of all the different stakeholders, the public sector, from the public sector, the promoters, the distributors, manufacturers, processors, even the practitioners, all the different areas that we had represented today, and all the impacts that they've been making to creating and developing the healthcare sector in Nigeria. But it's very clear that we need to do a lot more. And for us at Stanbic IBTC Bank, this event is just for us to create a platform to network, to engage, and to showcase to our clients and prospective clients that we are here, we're ready to partner with you, we're ready to grow with you in your respective businesses in terms of healthcare sector development. And that's why we have put in place this inaugural session. It's not going to be the last. We will continue to do this, and we'll make sure we sustain this. But for us, it's very key that we demonstrate that we are the reliable partner for you. And where you do need us to come in, please reach out to us. Reach out to us at sectorsolutions@stanbicibtc.com. We do have members of our team on ground. The head of the specialized sector team is also here, so we can also engage after this session. But we are committed. Our CEO, Stanbic IBTC Holdings, said it. We are committed to the growth of the healthcare sector, and it's an area that we're very passionate about. So thank you so much once again for being part of this session with us, and we wish you safe return to your various locations. Thank you.
Thank you very much, Olajumoke Bello. As we close, let us remember that healthcare is not a cost to be contained, but an investment to be nurtured. Thank you very much for joining us at this healthcare breakfast session organized by Stanbic IBTC Bank. We do wish you a lovely rest of the day. My name is Mojibadi Shosoya. It has been an absolute pleasure serving as your host. Thank you, and have a lovely rest of the day.
I care for 5 good years we have been in this shop. If it is to update your WhatsApp now, you will know how to do that one very well. Okay, I beg, no verse. Your money now 780,325 naira.
You no get person wey sabi everything for business. Market na teacher, trader na students, hand wey sabi na hand wey learn well.
You can pay to my accountant with our Stanbic IBTC POS. It go one time.
Business no be wetin one person fit do alone, because market na community. E dey work well when we join hand with people wey sabi business well well.
You outdid yourself. This dress is given.
Because na who get better hand of support go get better business. Everything for business na kparakpo. If correct business like Stanbic IBTC SME Collab Hand join your own with loans wey you go get, free business training and support, e sure say you go do big things. For Stanbic IBTC, we dey join hand with business people take grow their business. Go for growth with Stanbic IBTC. For enterprise direct at stanbicibtc.com or call 0700 333 3333.